To our April 14th County Board of County Commissioners business meeting. We want to welcome any of you who are at the Douglas County Courthouse or joining us online. I just want to pass on a bit of information regarding how we'll run our meeting on Zoom during this time of social distancing. If visuals are used during the meeting, the presenter will share their screen with participants will not be able to view them without a computer. Participants will be entered into the meeting with their audio muted, meaning the commission and the public will not be able to hear you. Presenters will be unmuted when their agenda item comes up. We ask that all online presenters use good conference call etiquette and mute their speaking and introduce themselves each time they speak. If you have a public comment on an agenda item or under regular public comment, please use the raise your hand function on Zoom. Staff will call on you and unmute you. We ask that speakers give their name and address for the minutes. We typically limit public comment to 3 minutes to allow for as many folks to speak as we can. The county reserves the right to shut off the microphone and remove any speaker from the meeting if they are vulgar, rude, or inappropriate. A recording of this meeting will be available on our website after the meeting. And we will start our meeting this evening with a proclamation, April 11th through 17th as Communicators Week in Douglas County. I believe that Tony Foster, the Director of Emergency Communications, is here to present the item.
Good evening, Commissioners. I'm representing the Douglas County Emergency Communications Center and our dedicated communication officers who work tirelessly to keep. Every year we answer the 911 calls and dispatch over 120,000 calls for service for police, fire, and medical throughout Douglas County. In a crisis, we are the community's first point of contact. Actions of the communications officers have an immediate impact of the outcome of those crises, whether that is instructing the caller to evacuate a burning building, teaching someone quickly how to perform CPR, or trying to help locate somebody that is having a medical situation in a remote location. Communications officers in many cases are the ones that are never seen, only heard, and easily forgotten. We are the calm voice on the radio, there for those who are in need. Please join us in celebrating by proclaiming this week as National Public Safety Telecommunicators Week. Thank you.
Thank you, Tony. Mr. Portillo, I'll go ahead and read the proclamation. Emergencies can occur at any time that require sheriff, police, fire, or emergency medical services. Whereas when an emergency occurs, the prompt response of law enforcement, firefighters, and paramedics is critical to the protection and preservation of property. Whereas the safety of our deputies, police officers, and firefighters is dependent upon the quality and accuracy of information obtained from citizens who telephone the Douglas County Emergency Communications Center, whereas public safety dispatchers are the first and most critical contact our residents have with emergency services. And whereas public safety are the single vital link for our police officers and by monitoring their activities by radio and providing them information and ensuring their safety, whereas the public safety dispatchers of the Douglas County Emergency Communications Center have contributed substantially to the apprehension of criminals, suppression of and treatment of patients, and whereas each dispatcher understanding and professionalism during the performance of their job in the past year. Now therefore be it resolved that the Board of County Commissioners of Douglas County, Kansas, hereby proclaim the week of April 11th through 17th, 2021 as National Public Safety Telecommunicators Week. And join us in honoring the men and women whose diligence and professionalism keep our county and citizens safe. Thank you so much, Tony. We really appreciate you coming to the County Commission today. I don't know if any of my fellow commissioners have comments.
Commissioner Reed here. Yeah, thank you, Tony, for providing a bit of background. I just want to appreciate that. I really think 911 is not only does the dispatch work of crisis intervention and emergency response, but that information piece of it is something that I think is sometimes overlooked or not thought about. And I know that dispatch public information direction to community members about some of the examples you shared, how to give CPR in a quick moment, an emergency response, but also how to navigate some of our other local systems and non-emergencies. So thank you for being here.
Thank you.
Tony, this is Commissioner Kelly. A lot about emergency communications last week and celebrated a lot of the success of your leadership in the department there. And just really want to highlight that they are first responders, and we appreciate all the work you've done, especially during times that have been pretty difficult in the last year. I'm sure you all have been very busy. So thank you for all your work.
Thank you.
This is Commissioner Berthiaume. Thank you again, Tony. And now we will move to our consent agenda. Would commissioners like to pull anything from our consent agenda?
No, thank you.
Sarah, do we have anyone at the courthouse who would like to pull an item off the consent agenda?
Is there anyone here who'd like to pull an item off the consent agenda? The agenda is in front of you. There's lists. They're over here on the, I thought you guys, they're over here if there's something you want to pull off the consent agenda.
And while folks at the courthouse are looking at that, we'll ask if anyone online would like to pull any items off of the consent agenda.
We don't have anyone here to pull an item off consent.
Okay, so and I'm assuming that means we also don't have anyone online. Thank you, Sarah.
Correct.
I'm not seeing anyone.
Thank you, Jill. We're looking for a motion to approve the consent agenda.
This is Commissioner Reed. I move to approve the consent agenda.
Second.
All of those in favor, please say aye. Aye.
Aye.
Thank you. We will move to general public comment. If folks have comments on a particular agenda item, we will take that with the agenda item. But for now, we'll take general public comment. Sarah, do we have anyone at the courthouse for general public comment?
I don't have anyone here for general public comment.
Jill, do we have anyone online for general public comment?
I'm not seeing anyone.
Thank you. To our regular agenda, we'll start with agenda item 4.1, consider an emergency order of the local health order, emergency order of the local health order. That's a lot of orders in that agenda item. I believe that we do have a presentation on this.
Commissioners, thank you. We're moving into the panel. County Counsel John Bullock, Assistant County Counsel Brad Finkeldye, as well as our local public health officer, Dr. Thomas Marcelino, and Deputy also moved Dan Partridge, our Director of Public Health, into the webinar as well. Commissioners, if you would like, I can pull up the order on the screen for the benefit of those watching online. If you'd like me to just share my screen in terms of the order.
Yes.
While I do that, I will turn over the presentation to, do you want to start us off? Or you're muted, Dan, or Brad. It sounds like Brad's going to kick us off, so.
Thank you, Sarah and Commissioners, for having us. As you know, under SB 40, we are now bringing the health order before you, as recommended by Dr. Marcelino and the health officers. And Dr. Marcelino will start off in a second. As you pull up the order, I will say we did find one typo in paragraph where it says Kansas. It should have said Douglas County, and we'll correct that when you have an official order or make any other changes. But we'll have a short presentation by Dr. Marcelino and then Dr. Scrimshaw, and then be prepared to answer any questions. So go ahead, Dr. Marcelino.
Yeah, hello, Dr. Marcelino here. Thank you, Commissioners. Thank you, Brad. And what we're presenting here tonight is the emergency order of the local health officers, myself and Deputy Health Officer, Dr. Scrimshaw. Throughout this pandemic, we've really been wowed by how the community has come together and done what's needed to be done to, protect the citizens and minimize the damage of the virus that has just upturned our lives. And one of the cornerstones really of doing this is the use of public health orders. And I think we've seen that the orders that we've had, during this pandemic, it's affected, every part of everyone's lives. But what we've seen with these orders is that they can really mitigate the spread of the disease. And we know this is a disease that's spread through respiratory droplets. And the cornerstone of this order that we really want to present tonight is the mask usage. So what we found is that mask usage and distancing can really affect the spread of the disease. And so in the least restrictive manner possible, doing the least we can without causing widespread, problems for citizens and businesses, we feel that a continued mask order is the least restrictive thing in order to prevent the spread of COVID. And we're coming really close to really hopefully getting a firm handle on this as we move into the future. And what we've seen with the vaccinations, with the continued mask usage, with the continued social distancing, I think has really helped with the pandemic, and we're starting to turn the corner. And what we don't want to do is let off the throttle here too quickly. We want to finish out our chance to prevent the spread, to get everybody fully vaccinated, to eradicate as much disease as we can, because with the emergence of these variants, we can't pull back just yet. So we really feel like this is important to continue the mask order and these distancing requirements that we see in this order. And I'm going to turn it over to Dr. Scrimshire to give us a little bit more background on some of this.
Sarah, did you allow me to share my screen today? Is that okay? Are you okay with that?
Yeah, give me a minute to stop sharing. Go ahead, Dr. Scrimshire.
So it seems like like common sense, like a law of gravity, most of these things to me, but it does not necessarily, it isn't the same for everyone. And so my goal was to gather some data to basically support what we're doing and what we have been doing for nearly a year, to help bring some data beneath the orders to show that these things do work, they do prevent transmission. My problem wasn't with finding supporting data, it was with narrowing it down. The first thing I wanted to show people was, just if this doesn't tell you that what we've been doing in Douglas County hasn't worked, then there's a problem. Our flu numbers, flu and RSV, so other respiratory viruses, we've had nearly zero. I think we ended up with a total of 3 flu cases for the year. So this, I'm just going to go through some studies very briefly. This was an early study from Kansas, actually, and it showed that those counties who implemented mask mandates had a decline in cases as opposed to those who did not, who had an increase in cases of 100% on 7-day rolling averages. This was similar to other states that had implemented mask mandates. This is a visual representation of when the mask mandates were put in place. Those counties that did not implement it continued to rise. The counties who implemented mask mandates had a decline in cases. This is another study that showed that in like 6 to 8 weeks after mask mandates were implemented, the excess number of cases was 10 times those. So those who did not have mask mandates had 10 times the number of excess cases as those who had mandates. They could have decreased the number of cases by 90%. This is just in the first 6 weeks. 90% fewer cases, 80% fewer deaths. And in just 13 states, 6 weeks, 50,000 excess deaths were prevented. This is a visual representation of the same thing. This is with and without mask mandates, a projection of cases over time. Another one, these kind of get into combining mask mandates and reopening, or mask mandates and in-person dining at restaurants and bars. Looking at case and death growth rates before and after mandates. This study looked at, there was a reference period around the time of the mandate implementation or reopening. And then two time periods before, and then several time periods after the implementation. Again, you're showing a decrease in the number of cases and the number of deaths I think the number of cases was in the first 20 days and death was after 40 days. This is increasingly important, and I can't really stress this enough, but we will start to see increasing numbers of variants. We already have variants in Douglas County, but as these pass through, which it will, we're going to have to be very careful in preventing transmission, because it's kind of like another wildfire burning through. Visual representation for I have two studies that have very similar graphs. This one was I believe cases. Oh yeah, on the left is the masks, and on the right is in-person dining. You implement masks, cases go down. You open restaurants for in-person dining, cases and deaths go up. Another similar study, this was cases increased 41 to 100 days after opening restaurants, deaths increased in 60 to 100 days after opening. As you know, these things are exponential, so it's not one person infects one person infects one person infects two or three, and those two or three go on to infect two or three more. So in 1 month, a mask mandate prevented over 200,000 cases within just a small number of states. These are just different things that restaurants can do. We know that closing things, while perfect for decreasing transmission, is not perfect for the economy, and it is none of our goals to adversely affect the economy of Douglas County and the business operators within. So these are just various things that restaurants can do. We do know that, like Dr. Marcelino said, mostly this virus is transmitted by respiratory droplets, meaning those people, that's the reason for the 6 foot of distancing. As I speak, I expel droplets, they get into the other person's eyes, respiratory tract, but there's also airborne transmission, although to a lesser degree. But when you have people who do not have masks on, who are eating and drinking and talking, they create airborne particles which stay in the air. If you have an enclosed space with inadequate ventilation, those infectious particles concentrate in that space, and there's a higher risk of transmission to other people. And it may not be necessarily within 6 feet. So restaurants need to make sure that they've got groups distanced by limiting capacity or separating groups, putting people outside, finding ways to increase the ventilation, making it clear to people where they can and cannot be, no gathering. This was looking at similarly mask mandates and in-person dining and the effect on cases and deaths. What I wanted to say, and I didn't include in here, is there's more data coming out about saliva virus being in the salivary glands. It will replicate, and as we eat and drink, you salivate more, and then you speak, your vocal cords create those very small particles that become airborne. But there's a growing body of data evidence that's showing that it's just supporting what we already know, right? We've seen these things happen. Now we're getting some studies that support it. The CDC is on the same page. I mean, everything that we have included in the public health orders is, I mean, it could have come directly from the CDC. Increase ventilation, keep people apart, keep people in masks. It's the same thing. Obviously, we can't keep restaurants closed the entire time. So how can we do this more safely? The same exact things over and over. I think that was it. Sorry, I went through that quickly. I will gladly share anything with anyone who would like it. Sorry, I ran through that so quickly.
And I would just finish up by saying, obviously, you guys have the orders. And then in that order, we set forth, the medical and scientific justifications and kind of a summary basis. And as it says, the health officer deems it necessary to issue this order mandating the wearing of face masks and curtailing the operation of businesses as set forth below as the least restrictive method for meeting its purpose based upon the medical and scientific evidence. And under SB 40, we need to bring that to you for approval. Again, short summary, although I know you've read it. There's a mask mandate, social distancing in restaurants, 50% occupancy in restaurants and bars. However, out of that by notifying public health and posting on a sign on their door. Again, details are in there, but that's the major highlights. Dan, I'm not sure you wanted to add anything, or John, but if not, we're open for questions.
I'll just stand for questions. Thank you, Brad.
This is Commissioner Portillo. I have a feeling we have a lot of interest in this particular agenda item, given some of the emails and correspondence that I received. So I just want to make sure that I lay out the process for folks who may not regularly join us. Now we'll ask our presenters questions from commissioners, and commissioners will have a chance to ask all the questions of our presenters. Then we'll open this for public comment, and anyone who would wish to give public comment will have about 3 minutes per person to provide public comment to the commissioners. Once everyone has had it, we'll close public comment and commissioners will have a chance to discuss, and commissioners will discuss before voting on anything. So just an overview of the process, but we'll start with questions from commissioners. So I do just want to say thank you very much, Dr. Marcelino and Dr. Scrimshire, for providing so much information. I appreciate part of your presentation. And I have a couple questions just kind of about COVID-19 and transmission overall, and then a question about the process piece. I really appreciated the discussion around kind of how this is a respiratory disease and what that means. That I've gotten from folks over the past week have really focused in on the personal choice aspects around masks. And the way I've really been thinking about this is similar to how we think about secondhand smoke. We used to have smoking sections in restaurants, but for any of us who went to restaurants when that existed, even if you sat in the non-smoking section, that smoke would waft over. So it wasn't so much about personal choice as kind of the environment that you were in. Is that what we see as kind of about this kind of correctly or incorrectly? How do we balance out that personal choice around what we're seeing when it comes to masks?
Yes, in my opinion, I think you're on the right track with that 100%. The reality is that when you're in space, you have the potential of interacting with other people. Now, an argument could be made, well, if everybody's vaccinated, then why do we need to wear masks? But the reality is everybody is not vaccinated, and we really don't know who is vaccinated. And, it's up to the community right now to protect not vaccinated and that are vulnerable and to to hold the course by wearing these masks to protect others and prevent that transmission from occurring, which can spread throughout the community and variants that are here. We've got to give the community a chance to distribute more vaccine, and I think that the masks are the least restrictive way to do that. So that's why the order is really curtailed to that, and you're eating and drinking important because there's no mask. So, but you're right with the smoking thing. I mean, it's about your actions affecting the health of other people.
This is Commissioner Portillo. Thank you. I really, you brought up vaccinations, which I love reading that Douglas County is county in the state of Kansas. That's super exciting. And I know that we're moving forward with vaccinations at a pretty great clip, which is great. But right now, vaccinations are only approved for folks over the age of 16. And so can you help us kind of understand, I know vaccinations are kind of outside of the order, but I think it's really affecting how folks are thinking about it. We know that children may not be kind of diagnosed with COVID-19 in quite as high of rates, but adolescents still don't have access to vaccines. Can you help me understand kind of how vaccine around these health orders, particularly around protecting people under the age of 16?
Well, I can jump in with a little bit of statistics. This is Dan Partridge, the director at the Public Health Department. As we look at it, we have pretty much vaccinated anyone over the age of 65. And then as we look at age groups progressively getting younger, the percent vaccinated progressively gets less. And when we look at who are the spreaders of COVID, it's that inverse. The younger you are, the more, to a point. If you're a teen and a young, the group that spreads COVID the greatest, and they're the least vaccinated. So it's not just the overall numbers. We got to look at who's been vaccinated. So we've got a long ways to go.
The way you do this, raise my hand.
Jump right in.
I'm sorry to cut you off, Dr. Marcelino. I wanted to, the last I heard, I think there may be an approval early summer for 12 to 15-year-olds, which is exciting. But right now, what we're seeing in other states with the spread of particularly B117, is younger and younger people getting sick. So it's attacking the kids at a higher rate than the wild type virus did, quite a bit higher rates. I don't have any numbers at this point. But not only that, but the hospitalization rate. So, it was, I would say 30 to 40, a couple of age groups in the 20s to 40s, and one hospitalized at like 50% higher rate, and one was 800% higher rate than previous. And these are our average age of hospitalized patients is dropping. It's fairly scary.
Thank you. This is Commissioner Portillo. One final question, this really has to do with process on the health order more than kind of context. You mentioned in the opt-out that individual businesses can opt out by writing into the health department. Can you help me understand, in a number of our kind of resolutions and a number of codes, we already have are providing public notice. Can you help me understand why you decided to go with writing into the health department rather than providing public notice? And if we do stick with writing into the health department, would folks who are opting out, would that be posted on the health department's website? How would the public become aware without having down to a business to see that sign on the?
Well, Brad might be able to answer this, but we talked about what would be the least restrictive way to provide public notice. And, putting an ad in the paper or whatever didn't feel like least restrictive. So that was the solution we came up with, as trying to balance what's going to be easy for the community.
Well, and I guess that from the least restrictive perspective, there's already a process for public notice, and there's not necessarily for notifying the health department. So really, it's this is an open question for me. How do we decide what least restrictive is? Because if we're creating new processes from an administrative burden perspective, there's both a burden on the health department because you all have to collect those notices, publish it on a website, publish it to your social media, make sure that folks can see it and know about it. So you have an administrative burden. This is where it's a new process, and that newness may make it more difficult than public notice. I recognize public notice because it's taking an ad out in the paper. There's a financial cost to it. Own entity because in so many other resolutions and codes and processes. So I'm not really sure which one makes more sense from a least restrictive standpoint. I also wonder whether you all have the administrative infrastructure to collect any of those and make sure that they are publicly displayed, and I would be accessible for folks in the community to have the information of any business or business owner that decides that their business is opting out of these particular health orders. So what would that implementation look like?
If I could, this is Sarah Plinsky, County Administrator. If I could chime in a little bit while Dan and maybe Brad are thinking about that implementation piece. In relationship to our existing public notices processes, I would say that in many of those cases, if we are required by some sort of statute to publish in the paper, the county bears the cost of that publication. So I would want to vary from that process to not have the county bear the cost of publication in the paper. Commissioners know I've spoken about it before. Publication in the paper is pretty pricey. So that cost could be, and we also have a situation where fewer and fewer people don't read the paper. And you do have to, you cannot access the paper for free. So I do worry a little bit about some of the accessibility there. The other things we do for notification involve mailing letters to people's homes in a surrounding area. Given that this is a public situation, not knowing who might be coming and not be coming, I think we were a bit challenged as to how do we approach what's the proper way of notification. And I appreciate the commissioner's questions in terms of, what processes we already have in place, but it doesn't feel like we had some good fits on our existing process map. And I don't know, Brad or Dan, if you want to chime in with additional information related to what's required under Senate Bill 40.
Well, I was just going to add, speaking to the question around capacity, does the public health have the capacity? I believe we do. We've actually, have staff that have gotten used to going out and, doing inspections, visiting with restaurants and bars. And so we've kind of built up a relationship with owners and law enforcement who support that work with us. And I'm not saying it's a perfect process, but we feel confident we can execute it.
This is Commissioner Portillo again. I am a bit concerned with the way that the order is written. It's just saying that business owners would have to write into the health department. It doesn't then say how the health department will convey that information to the public. So I would like to see some additional information on how the health department will make sure that the public has access to which businesses have opted out.
We have prominently featured on the front page, and then there's many elements of our website that speak to COVID, but we just create a front page kind of widget that takes you to a page where we maintain the list.
If I could chime in there too, Dan, if I think I understand what the commissioner is asking for, we can work closely with public health and our public information officers to make sure it's very prominently displayed on both our Coronavirus Hub website and public health, and ask our partners to help also link to that information. I think that's definitely something we can take back to Unified Command and talk about how we improve that information and publication, and also the specific requirements of what's required to be posted at a business as well. So some of the procedures related to this policy statement related to public health orders, we can certainly follow up with the commission on that. John, it sounds like, yeah, go ahead.
Yeah, and I wanted to just add a comment from the legal perspective in that the way the statute is designed is the the measure that you implement should be the most narrowly tailored or restrictive means to achieve the stated purpose. And so Commissioner Portillo, if I'm reading into your comments, it sounds like a purpose you're exploring might be to provide easily accessible notice to the public of businesses that are not following certain aspects of the order. I'm not a physician, the doctors will have to speak to this. I could imagine a case could be made that it promotes good public health for people to know if they go into a business and not be surprised, for example, to learn that there's non-compliance. And so, again, I don't have an opinion about what you should do. That's up to you. But I would suggest that if you want to articulate a purpose that you think is important, and if the physicians have input on that from a public health standpoint, that could be useful. And then tie your notification procedure to that, and then evaluate whether the notification procedure is narrowly tailored in light of that particular purpose.
And
Thank you, John.
I would just follow up on that and what Sarah said. And I guess I think about it as a little bit as Sarah talked about, this is the order of what the business owner has to do. It's not an order that tells public health or anyone else who has that information what they do with it once they have it. So as Sarah said, we can work on that end once we have public health has that information to spread it in any way that we want. The narrowly tailored is what does the entity have to do in order to opt out? And we thought this would be the least restrictive way of doing that. Although, as John says, depending on what your purpose is, there could be some other ways to do that.
Thank you. Those were all of my questions. Fellow commissioners, do you have any additional questions before we open it up to public comment?
This is Commissioner Reed here. I'm not sure who this question is best for, so I'll just pitch it. And I'm wondering what can be said about accommodations for people with disabilities or medical exemptions. And I'm wondering what that looks like in the school district, for example, and how if these orders account for that specifically. Or, I mean, we're talking a lot about business opt-outs, and I guess I'm wondering if somebody can help me understand more about individual accommodations or exemptions.
Yes, Brad Finkelstein, I can respond to that. First of all, under SB 40, these orders no longer apply to a school district. So the school districts are controlled by the school board and they make their own decisions. And so this is not binding on any school district. And they now have their own process for anyone aggrieved on that. Second, I would add, in general, this mask order has exceptions in paragraph 6 related to medical conditions, mental health conditions, disabilities. This is the same mask order, frankly, that the governor issued with the exceptions a very long time ago, and the same mask order that's been in place since, I can't remember when, April or May of last year. And I think, the doctors and Dan can jump in, but I think we've worked through that with people who have different issues with these exceptions, and we haven't seen that as being a problem or getting pushback on that. So I think there are all these exceptions that have worked not only here in Douglas County, but across the state for those sorts of issues.
Thank you, Brad. I don't have any other questions at this time.
I have a few questions first. So this may be, this Commissioner Kelly, a question for Dan, I think. But Dan, a lot of the communication I received was around non-elected public health folks, essentially legislating what we do, creating mandates. Is there times can you give examples maybe of past health order, public health issues that have come forward to governing bodies for the betterment of public health? I mean, so like, is seatbelts a good example? Is speed limits? You know, I'm just trying to think through that.
I'm not sure this is where you wanted me to go, but two things come to mind. One being, the isolation and quarantine orders have been part of public health practice consistently throughout the decades and over a century. And so, up until COVID, that was more around tuberculosis and some of those other diseases that are not as frequent. Varicella might be another one, pertussis. So those are kind of tried and true public health orders kinds of areas. This notion about non-elected making decisions like that, the analogy I heard from the Kansas Association of Counties was it's would be like your county engineer inspecting a bridge and saying, we need to close this bridge. That's a non-elected official impacting people's lives. And we've been okay with that for a long time. I don't know if that helped or addressed what you were looking for.
It sort of does, but it seems like I remember when we were talking about anti-vaping and smoking cessation, that there were issues that public health brought forward. And I think in that case, the city, because the county has limited abilities when it comes to those types of things, that there have been times in the past when public health has brought forward public health issues that then a governing body may decide to act upon. Is that correct?
Oh, yes, absolutely. Sorry for being a little dense there. Yeah, that's certainly true, and I hope it continues to be true.
Okay. So what we're doing here, I guess I just wanted to confirm that what we're doing here really isn't that out of the ordinary, that this has happened before in order to protect public health, to maybe limit someone's ability or freedom, as some would put it, to do certain things by creating orders or laws to protect public health. And I hear you confirming that, yes?
Commissioner Kelly, this is Sarah Plinsky. If I could chime in on some of that. I would say as a role of a local government, oftentimes we're in a regulatory fashion on a variety of different methods where we take information from subject matter experts in a variety of different fields, public health officials, engineers, criminal justice professionals, all types of folks, and we take that professional expertise, present it to the local representatives, and they make decisions in terms of how we move forward. I do think that is a positive part of this change in Senate Bill 40 is it allows this to come to the county commission and specifically have this place of review and this pace of public input on the process. But in terms of our role as a local government, in terms of regulating both public health, public safety, and security, we step into those roles on a very frequent basis. And I trust that our elected representatives will continue to be mindful of all of those competing values when they make decisions.
Thanks, Sarah. So that flows into my second question, and this is for Dr. Marcelino and Dr. Scrimshire. I really appreciate all the studies that you shared. And we received, I can only speak for me, but well, no, actually, sometimes they CC'd all three commissioners. So we received a lot of communication with a lot of studies. And I'd be interested to hear how, one, you choose which studies that you referenced and find the evidence, and two, how you work against confirmation bias. So there's a lot of themes within our emails that, well, you're just choosing the studies that are going to support your particular point. Can you talk about sort of, and I'm going to guess it comes from your background as a scientist and as a doctor, that you're constantly working against confirmation bias, but can you give us a little glimpse into how you work on that?
Yeah, I mean, a lot of my stuff actually comes from either the state health department or the CDC. I mean, that's typically where I will hear about it. Sometimes when I'm looking to, get into the weeds a lot on a specific topic, I'll go looking for studies. But yeah, I mean, I had an entire semester, an entire class just on how to go through like clinical trials and go through these steps and to tell whether or not it's a good study or not. So I don't know, that's like just always there. Like, I mean, just as you read it, oh, that has an N of 20. Well, it's probably not very useful. Oh, that statistical method does not match what they're trying to prove. I don't know that I'm answering your question. It's something, sorry. It's something that I think we always do. It's part of our training. And I generally am guided by those, CDC and the state health department.
Yeah, Dr. Marcelino here. I would agree. I mean, I think it's a combination of, your prerequisites for medical school leading up to statistics classes, epidemiology, and looking at your medical background, as you get your medical doctorate, and then your clinical expertise, through the practice of medicine, to combine the skills and things you've learned throughout your career to then read a study and determine its value based on how the study was done. And so really that's what we try to look for and really try to validate studies that way and choose ones that are done well. And I think the CDC and KDHE does a good job of finding those as well. And so I think the science is clear that masks work to prevent the spread of COVID. So.
Thank you both. I have just a few more questions. You said masks work to prevent the spread of COVID. One thing I didn't see a lot of in the presentation, and maybe it was there, it just went by quickly, was the distancing. And I am assuming that your 50% capacity is based on the ability to distance at 6 feet. Dr. Schrimsher, can you talk about that? I mean, I'm guessing that because you're recommending it, there is evidence behind that, and maybe it was in there and I missed it, but do you want to talk about a little bit that part of it?
There's two components. One is the droplet part. So that's generally where the 6 feet comes in. And then the other is the accumulation of aerosolized particles and the dedensifying a space so that you don't accumulate those particles. My preference, I shouldn't say preference, just my brain, when I try to think of this, it automatically goes to, well, just calculate 36 square feet for every person you have in a space. And that's not necessarily doable, especially for outdoor spaces. And I think it was, a combination of those two things and then trying to pick something that was reasonable and consistent. Many other places are using 50%. I went through a bunch of them the other day.
Yeah, Dr. Marcelino here. I would agree. And part of the thing is that we've shown that restaurant environment, bar environments can be a higher risk for the spread. So, the least restrictive thing would be to go ahead and allow restaurants and bars to stay open. But at least if we're going to have masks off, let's have some distancing to protect against that transmission. So that's in my mind where that would come from, is the least restrictive thing is, okay, we need to allow restaurants to go ahead and stay open. But if we're going to be in that environment, that high risk environment, then let's have some distancing.
And final question, sorry, commissioners. I got a lot of emails about how we've had enough of this. This has been long enough. This has been hard. And I heard both Dr. Marcelino and Dr. Schrimsher talk about how we're not there yet. We haven't gotten to a point where we feel comfortable removing health orders. Do you have any thoughts on or what you're looking for when it comes to changing a health order when if we choose to approve this tonight, when you might come back to us with a less restrictive health order?
This is Scrimshire. Yeah, I'm looking for two things. I'm looking for vaccination rates and I'm looking at case rates. Right now, we have a low, combined with testing. So right now, we have been at a low spot as far as the case rates for quite a while, but we're not testing very much. So I don't know that we have a good handle. I don't think we're doing adequate testing to know the amount of disease we have in the community. I think that is somewhat misleading. But we have to get vaccination rates up. There's no question, because when you leave half of the population unvaccinated, you're doing a couple things. You're open to another surge, but you're also creating a selective pressure on the virus to select for strains that are more likely to be resistant to vaccination and monoclonals to therapeutics. So I want to get people vaccinated, and as we vaccinate, we will see those levels drop further. I mean, that's what I'm waiting for.
This is Brad. I would add that under SB 40, there must be a expiration date for the order, and the one prescribed before you is May 19th. Obviously, you have the right to change that date, and obviously you could amend it at any time, but there has to be an expiration date in the order, and that's the date that's currently in the order.
Thank you. That's all my questions.
This is Commissioner Portillo. So we will open this up to public comment. Just a reminder that we do keep public comments to 3 minutes per person, so we can have as many folks speak as would like. Sarah, do we have anyone in the courthouse who would like to provide public comment on this item?
I believe we do. If you'd like to come forward for public comment, please just sit here and I'll turn you around. And if they can hear you.
I can hear them from here.
Okay, so hold on just a second. I just want to tell everybody who might be participating in public comment, we need you to state your name and address for the record. So go ahead and I'm going to turn it around.
My name is Rachel Price. My address is 525 Lawrence Avenue here in Lawrence.
I'm sorry, we can't quite hear you.
Okay, I'll speak louder. My name is Rachel Price. My address is 525 Lawrence Avenue here in Lawrence. So I have comments, but I'd also like to address some of the things that you've all said, if that's okay. Is that okay?
Yeah.
Okay. So first of all, I wanted to ask, do you have any opposing views? I hear Dr. Marcelino and Dr. Scrimshire, but have you had any other doctors that have an alternative viewpoint? I'm not sure if you're aware of the Great Barrington report, but there are thousands, literally thousands of doctors all across the country who have disagreed with the lockdowns and with the mask mandate. So I want to find out why you don't have an opposing view in your presenters. So I'm just gonna, that's a rhetorical question. I'm just gonna leave that out there. But things that I heard that I just questioned. One, Dr. Scrimshire, you had said the youngest people are the ones that are the biggest spreaders of the virus. Science does not say that. So I would like to see your science. I'd like to see that presented to the public, as well as the other science that you've mentioned that you have. I think it would be fair for the public to see the science you're using to make these decisions. You'd said the social distancing should be 6 feet. Well, the CDC just came out and said 3 feet. So in schools, so if the children are the most liable to be spreading this, why did the CDC just lower that social distancing to 3 feet? Let's see, mask exemptions. You said you haven't had any problems. I can tell you that is not true. All across Lawrence, there are problems with mask exemptions. Those businesses don't realize that you allow for a mask exemption. Children are being called out in public, in stores. Parents are being called out for not masking their young children. And businesses are not allowing the mask exemption or the health exemption. You said the quarantine's been around for hundreds of years. That is not true. The quarantine, yes, quarantine is for sick people, not for healthy people. There is a history of quarantine, but never before have we quarantined healthy people. The secondhand smoke argument. You can't legislate secondhand smoke, and we don't legislate secondhand smoke. Outdoors, I'm going to come across secondhand smoke, and that is just life. I could walk away from that secondhand smoke, but you can't legislate it. The CDC, let me go back. You talked about the bridge argument. We asked our public officials to help us make decisions about bridges. That's a bridge. This is my body. That's a different ballgame. I don't think that argument stands. Then I want to go to what I came prepared to say. That's just my reflections on what you said. All along this pandemic, we've heard that what does it hurt to wear a mask if it's effective? And we've heard follow the science. One side note, the CDC, I hear you saying you use the CDC. The CDC is heavily funded by pharmaceutical companies. There's a huge conflict of interest, not just pharmaceutical companies, but corporations like the Coca-Cola Corporation. I mean, please, you have to follow the money. There are alternative perspectives. About the mask, back to that, the science, the facts, and I'm happy to provide my sources, although I hear you, everyone can find some kind of source to back up their argument. But the science before COVID was out about masks. Paper masks contain all kinds of toxins. They contain formaldehyde, fluorocarbons, and an asbestos-like substance that's called graphene, micro-sized plastic fibers. And these masks are made in unregulated factories in China. We've all seen the video of the sweatshop assembly line where people are making these masks. They're not wearing masks, they're not wearing gloves, and the masks are falling on the floor. Just recently, we're seeing videos of masks that contain parasitic worm-like creatures that are servicing.
Ma'am, you're at 3 minutes, so I just want to make sure that you wrap it up.
I asked if I could respond to your question, so I'm going to keep talking if that's okay. I'm almost.
We want to make sure we have time for everyone to speak, so we're going to keep everyone to 3 minutes. So you can wrap it up in the next 30 seconds. Thank you.
As well as in Canada and Europe, because the masks contain fibers that are causing people to inhale, harm their lungs. The humidity inside the mask allow bacteria and mold to grow and multiply. And these masks are worn by children and people for up to 8 hours and more every day, every month in their cars, outside, while participating in sports, while giving birth. And now there's even a study that says we should wear a mask during sex. I have a friend who doesn't go to church anymore because she has to wear a mask Monday through Saturday. Sunday is the only day she can breathe. And now we're told we have to wear 2 masks, and 3 is even better. So I think that we're going to be seeing class action lawsuits for lung damage, just like we saw with tobacco and asbestos. In fact, my doctor here in Lawrence sends a monthly email, and this is what he said in his email. In our offices, we are seeing a near 100% side effect from wearing a mask during this pandemic. The severity has increased on a weekly basis over this time. What we're seeing is the mask is throwing people's jaws out of alignment. It's causing migraine-type headaches, dizziness, upper neck tightness, and jaw pain. Finally, Dr. Lee Norman's infamous graph demonstrated that
we're going to have to go on to our next public comment.
about 77% more daily cases per capita. What is the goal? That's what I'd like to know.
Is there anybody else who would like to speak for public comment? And state your name and address for the record.
Yeah, my name is Megan King. I live at 880 East 500 Road. And I have a couple of things that I'd like to make a comment on. First and foremost is that these mandates are crippling our economy here in Lawrence. And all you have to do is walk down Mass Street to see that. There are small businesses that have been ruined by these heavy-handed mandates, and they need to be lifted. You know, there is such an offset in what has happened, how this affects small businesses, and meanwhile, Amazon and Walmart are making billions. So I would just want to say that there's also a portion of our population that doesn't want to shop here because it's not friendly because of the mask mandate. And so they choose to go to Johnson County or to the west to Shawnee County, where that's where our tax dollars are going. And the other thing I wanted to discuss was the psychological effects of the mask wearing, specifically with students. You know, we want our kids to be engaged, encouraged, and recognized, but by covering their face with a mask and the teachers, we are not engaging our students, encouraging them, or recognizing their downfalls when they're stressed or having a bad day. And so teachers do keep trying to encourage the children's through the masks, but the students can't see when they have a smile on their face or know, you know, when they're being encouraged. And our mouth is the largest expression of our face. And if we can't see a person's mouth, we don't know what they're feeling. So what does all of this say to a child? Well, shy, quiet, and introverted personalities become more withdrawn, more quiet, and less engaged. And class participation is reduced. And not only for the shy students, but all children have less participation. They don't want to bother with talking louder through the mask, and they tire of taking it on and off. So they just sit quiet and say nothing, not asking the proper questions to get clarity on what it is they're learning. But what children are learning in school from the mask wearing is fear. They have fear of the teacher, they have fear of each other, and they have fear of breathing our God-given air. Prolonged fear becomes terror, and terror becomes trauma. So please save our children from the psychological trauma of mask wearers. And I do want to say that statistics do show that Douglas County was not better off than other counties without the mask mandate. And cases have fallen naturally here in Douglas County, as they should over the several months.
We're over your 3 minutes. If you could please wrap it up.
Douglas County needs to weigh the effects of the cure to the effects of the disease.
Is anybody else?
My name is Lori Belcher. I live at 1711 East 1000 Road in Lawrence. Good evening, and thank you for the opportunity to speak on this very important issue tonight. While people debate whether or not masks work, and sadly, I think we're dipping into two different pools of information so we can come up with whatever we want to support this. One thing is not debatable when it comes to this virus is the healthier you are, the better you do. As someone in the health industry, when COVID first appeared and we didn't know anything about it, I wanted to get as much information as possible, and I began to research a lot. One thing that kept surfacing in the health practitioner communities was the importance of vitamin D when it comes to the immune system. I have known this for quite a while and have been taking supplemental vitamin D for years. Studies in the past year have shown that those with deficient vitamin D levels, considered to be below 20 nanograms per milliliter, do not fare well with this virus. Most people in the US have a vitamin D deficiency. Geographically, most of us cannot get enough vitamin D from the sun and need to supplement. The groups most affected by vitamin D deficiency are the elderly and people of color. These are also the groups that are doing very poorly with COVID-19. For those with vitamin D levels above 20 nanograms per milliliter, which is actually very low, many practitioners, including my own, believe this should actually be above 50. There was shown to be in one study an 82% reduction in ICU admissions and a 64% reduction in mortality. Vitamin D is both very safe and very inexpensive. This box of vitamin D provides 15 weeks of doses, and it comes down to 60 cents per week, which is extremely cheap. Adequate levels of vitamin D not only help reduce the severity of the virus, it also has been shown to help fight it off in the first place. My husband and I both take supplemental D, and our levels are around 80. Our son brought COVID to us in June when visiting, and we quarantined together for 14 days. Neither of us came down with the virus without using masks or social distancing. We lived as normal. Vitamin D has also been shown to improve outcomes with many other illnesses like the flu and cancer. I would love to see the Douglas County Health Department roll out a vitamin D campaign, starting with the most at-risk people to get them on a vitamin D regimen. I would love to be a part of something like this, and I know many others who would also. If we can give out free flu shots, surely we can give out free vitamin D. It would also help with things such as variants. If you're talking about giving vaccinations, there's going to be variants. These vaccinations aren't going to cover the variants. Vitamin D will help with that. We need to focus on supporting the needs of the unhealthy instead of masking the healthy. People say we are being selfish by not wearing masks, and we need to think of others. Many of us work very hard for the health we have. Our health is our commitment to the health of others. A strong immune system helps to support another person's weak immune system by not letting this virus continue and building herd immunity. I can no longer wear a mask because I developed an infection from wearing masks, which required an antibiotic. This doesn't support my immune system in any way. Masks bring down the immunity of the healthy, and they don't bring up the immunity of the unhealthy. Our bodies are incredible machines made for things like fighting viruses and are very good at it when given the right support. I ask this commission to take an unprecedented step to help the overall health of our community. Instead of continuing this mandate and hiding behind masks for the unforeseeable future, let's get to the root of our illness. And that
You're at 3 minutes. If you could please wrap up.
I'm almost done. And although it by no means is the only route, vitamin D deficiency is an easy, inexpensive, safe place to start. Thank you.
Hi, my name is Hillary Brown. I live at 2304 Westdale Road. And I'm first going to read from Lawrence resident Whitney Schneider, a statement that she'd like for me to read. I'm a mother of 2 young children, local business owner, and KU alumni. I implore you to lift our local mandate and make it optional for residents of our county. I understand the concern for masks. I have an equal concern for not discriminating against those who can't wear or shouldn't wear them. These include individuals with other health concerns as well as individuals with disabilities. My son has not been and cannot return to school because he cannot wear a mask. He looks typical, he is not. Yet him and others like him have been completely disregarded with the imposition of mask mandate. This is medical discrimination and discrimination of individuals with disabilities. I've always thought of Douglas County as helpful and inclusive until now. The state mandate has been lifted. Other counties have made it optional. We can too. Please consider those you've left behind. You didn't before, now you can. And if you don't, I hope it weighs on you as much as it weighs on families like mine every single minute and hour of every day. That was Whitney's statement. When COVID first began, I hoped it would offer an opportunity for health officials to share and offer supplemental vitamin D, vitamin C, zinc, iodine to prevent COVID illness. I wrote an article for Spot Magazine last summer about it. And I have helped a number of individuals recover from COVID-related illnesses. And one individual in April of 2020 was really on her deathbed, and she had begged to leave the hospital. She had numerous comorbidities and health concerns, health issues in her life, but she was dying in her own words, but she begged to go home to die in her husband's arms. And I put on her porch some of these supplements I mentioned and told her and wrote what to take. And in 2 days, she was doing so much better. And there was no treatment at the hospital to speak of. And so I'd love, like Lori discussed, to speak more in depth about how we can get creative as a county, and we might be able to distribute supplements or at least start to have a discussion. And it was very disappointing to see that on this talk tonight that there was no opposition to what the doctors were sharing, that are only listening to CDC data. And CDC, as Rachel mentioned, is heavily funded by pharmaceutical industry. So I think we do need to follow the money. And I think that we can come up with some really great ideas. It was interesting to note tonight that I didn't realize it's a school board that we need to be discussing masks in schools, because my son really wanted to go to school. He doesn't want to be alone. He wants to be around people. And I was concerned about the mask, but I trust him and I wanted him to be around people. But it's super anxiety producing to see these children with their beautiful smiles, their nose in their mouth intended for oxygen, to be covered. And also the research that I've seen and would love to share is that children are not the ones causing COVID infections. In fact, they don't have ACE2 receptors in their nostrils. It makes it so they don't really get it. And even if there was a grandmother that wanted to see your grandkids, I feel like she should have the freedom and choice to make that. She's a grandma. She should be able to make any choice that she wants about seeing her grandchildren, whether there's a mask or not. And the fear that's being created and taking away our own personal liberties and our health decisions. Because some of us choose to vaccinate, some of us don't. Some of us choose to get acupuncture or take pharmaceutical medications. And I believe in the people of science. I believe that we all do approach health differently. And I think the overwhelming majority of people in our community make the best decisions for themselves and others. And I've even really noticed recently, everything from the way people drive to the grocery store, I'll see somebody with 2 masks on, talking to somebody with no mask, and they're super courteous and nice to each other. I think that our community is realizing that we're all where we're at. I respect the person who wears a mask. I think we're doing what we believe is right and trying to be careful. And the people that don't have masks on usually stay 6 feet away from other people. And I really have a lot of faith in this community to respect one another and come up with creative ideas that help to support our health. So.
Rick? Commissioners, I think we've got one more. You can sit, you can certainly sit there if you want. Go for it.
My name is Rick Renfro, and I live at 1176 East 1150 Road. And at first, I thought it was a mistake for this SB 40 to be passed, because I thought the health department would look at science and data and make good decisions for all of us. But now that I've seen this discussion here and people getting to give feedback, I've been working with the Restaurant Association through this whole pandemic, and it's been frustrating not being able to get our voice heard. So unfortunately for you commissioners, but fortunately for the community, people are going to get to have a voice. And I think I might try this vitamin D, Hillary. That sounds really good. I'm all over that. So what I am going to say is, number one is an end date. Like the commissioner said, we got to have some kind of an idea, and having an end date of the 19th is okay. I wish it was the 11th, and I know it's not an end date, it's a reevaluation date. But for shorter term, for all of us to look at and see, hey, we can last this for another 2 weeks, another month, whatever is huge and big. And then I also will say that I'm glad that I hope you will pass this, and I hope you will recommend and mandate masks with the exceptions of people that can't, because in the business world, it's impossible. If the county doesn't have this law, I won't be able to get people to wear masks north. It happened in Shawnee County 3 weeks ago. They got rid of the mask mandate. We kept the mask mandate, but I'm losing customers every day. Saturday, I was there and 50 people told me they would never come back again because we're requiring them to wear masks. So at some point in time, the public pressure is going to force all of us to say, hey, we can live with a 4% or 4 COVID people a day on a 14-day average, as long as our vaccination rate is up to 50% or whatever. But the day is coming sooner than later. That's all I have. Thank you very much.
Thanks, Rick. Anybody else want to speak? You want to speak? Okay, great. Commissioners, I believe that's everyone here at the courthouse. Jill has some folks online, it sounds like.
Yeah, we're going to start with Nate. Nate, you're in the panel, so go ahead and speak.
Hi, my name is Nate Mortius. I live at 504 Arrowhead Drive, Lawrence, Kansas 66049. I believe resolution number 2109 concerning new COVID restrictions is a good step, and I certainly support mask usage. But we should work toward reducing restrictions further in the near future, or even revise this order to some extent. In the same ways, I'd agree with what Rick Renfro just said. As a Frontlines ER and ICU nurse for the past decade and during COVID, I can tell you from my direct experience that COVID is not the only major problem that our healthcare systems face at this time. Another major problem is mental health. From day to day, my ER sees approximately triple the mental health patients that it did even 3 months ago. When I say mental health patients, I mean patients who have come to the emergency department with the chief complaint of suicidal ideation, homicidal ideation, drug or alcohol detox, psychosis, behavioral health assessment, or depression. Domestic assault victims might also be added to that list, even though that is not directly a mental health problem, but rather an indirect result of a mental health problem of someone in their household. These patients may or may not be admitted to the hospital, but they have come to the ER with any one or more than one of these chief complaints. So for those getting admitted, extra staff is required to sit one-on-one with patients who are violent towards staff, suicidal, homicidal, or psychotic, to ensure the patient's safety. They require extra attention related to caring for their needs. As they are in crisis, they often need the support of various PRN medications, redirection, therapies, and in extreme cases, even restraints, which require very close observation. Hospitals do not have the resources, neither economic nor human, to meet these needs at the level we're currently seeing them for long periods of time. As far as COVID goes, we're not even close to overrunning our hospitals anymore. But with mental health, the other day, I came to work in the ICU to find that over half the patients were there for alcohol detox. I believe the mental health crisis has gotten so bad because it is an unfortunate and unavoidable result of social isolation, which was used in its proper time with proper intent to protect our community from COVID. I agree with that. It still has consequences, though. Moreover, things are very different at this time than they were a year ago because of the vaccinations. Restrictions should be loosened because vaccinations have reduced COVID transmissions and mental illness is skyrocketing. On a personal note, one of my best friends died from alcohol detox at the end of last year due to depression related to social isolation. In addition to being a registered nurse, I am also a business owner. My business, RPG on Massachusetts Street in Lawrence, has written into its DNA a natural bent toward helping in the effort of preserving mental health. Our mission is to build community, and we accomplish this by promoting camaraderie over good food, drinks, and playing board games. The relationship building accomplished in our establishment is substantial, and it helps people feel a sense of belonging, mutual respect and compassion, and even in some cases, a sense of purpose. We promote diversity, acceptance, and love for our fellow humans. These things are the building blocks of mental well-being. But we still sit at a significant loss month over month as a result of these restrictions. Even further, I still have to turn away customers because of our capacity decrease. I have kept my business safe as a healthcare professional using hospital-level policies and procedures to protect my employees and our patrons, and I'm confident we're avoiding a large portion of the risks associated with transmitting COVID. With this new emergency order, we will still have to socially distance, but have the option to opt out of the 50% capacity limit. However, with social distancing requirements, even if we opt out of the order, we would still, in effect, be at the same 50% capacity limit, and I will still have to turn away customers. I made the decision to pay my employees a living wage when COVID started. All of our employees are paid no less than $15 an hour. This was to protect them from the labile nature of tipping during the pandemic. But without the ability to increase our revenues due to the capacity restrictions in place, it gets harder and harder to pay them what they deserve. And these are our neighbors, our community members, and those who serve us when we go out for a night of normalcy at a restaurant. My goal as a citizen, community member, and business owner is to obey the laws and ordinances put in place for us by you, our representatives. But there are many who are not doing that. They already operate without concern for public safety or law, and those businesses are taking the revenue my business would otherwise receive.
We're over 3 minutes. If you would please wrap it up.
Yes, I'm just so sorry to say that we can't keep this up forever. For the reasons that COVID is declining related to vaccinations, mental health is our fastest growing crisis, and to help good law-abiding businesses such as mine stay afloat, who in turn help the community and further our mental well-being, please loosen the restrictions even further. We are the most vaccinated county in the state and yet still the most restricted. I support this emergency order as a stepping stone, and I support the use of masks, but we need to pull back restrictions even more in the near future to restore our mental and economic well-being as a community as our health rebounds as well. Thank you.
See, Michael Davidson, go ahead.
Thank you. Good evening, commissioners. I don't know if you could see me, but can you hear me?
You
Perfect.
can,
Okay.
please go ahead.
I'm not going to repeat all the comments that have been made about the rate of vaccination here in Douglas County, and even a story today in the paper that talked about 60% of the employees and 18% of the students at KU have received at least one COVID-19 vaccine. I think the county has done a credible job. I think the way this ordinance is written is not intended to hurt the business community, but it will hurt the business community. As the doctors referred to the restaurants, that's what you were focusing on. If a restaurant decides to opt out of the occupancy limitation, it feels like they're going to have a scarlet letter effect. It's going to be on the window of their business saying, we're not following the health orders. We've decided to opt out on that. In this time of social media cancellation culture, my fear is some people are going to start listing all these businesses as a place you shouldn't go to because they're not following the orders of the county. I think that's really a negative effect. I'd like to see if we can figure out a way not to do that. I do think that it's time to loosen up the occupancy levels. And I also am concerned about the effective dates. The legislation is supposed to go into effect April 15th, go to May 19th. That's a week after KU graduation. KU graduation is a very big economic engine for our community at a time that we need that. So if that could be scaled back to maybe May 11th to look at it again with the opportunity of allowing more businesses to participate in the KU graduation, because we know what they do. We know they go to restaurants, we know they go shopping, but this limitation is not going to allow them to really begin to come out of this on the other side. So I urge you to look at maybe coming back and reviewing this in early May with a decision of maybe you can lift more restrictions. But again, I just want to go back to the idea that I don't think it's the intention of this ordinance, but to single out businesses to decide to opt out, I believe is going to have a big backlash from the community. I'd like to figure out a way to avoid that if you can. Thank you very much.
Nicole, go ahead.
Okay, can you hear me?
We can, please go ahead.
All right. My name is Nicole Vanicola. My address is 617 Locust Street in Eudora. And I'm not going to be going into major stats today, but kind of a more personal note, because I know with the numbers, many times what you're looking for, you find what you're looking for. But when we do look at the numbers, as I believe it was Nate, which I don't know him, but it had said, they do show significant damage to mental health and different things like that, to our children. And to our economy, as multiple people have noted, whether it's, depression, anxiety, suicide rates up, jobs lost, businesses closed. But I want to point out another area to consider, which is the specific intricacies of personal health issues that cannot possibly be considered when a mandate is forced upon everybody as a whole. Now, we all know, of course, that there are medical exemptions to the mask mandate, but most people and even some businesses don't know that there are exemptions. And even if they do know, they don't care. And they are overtly rude. Some people border on harassment and even step over that line. and they outright refuse business to people who cannot wear masks. These masks have inadvertently given people permission to be rude, hateful, and discriminatory. So my own personal story from my family is my husband had 2 nearly fatal strokes 2.5 years ago at only age 34. We discovered that for him as a stroke victim, getting oxygen to his brain is vital for his continued functionality, and masks restricted that oxygen enough to seriously medically harm him, to the point that he occasionally wasn't even able to function. And we worried that another stroke was imminent. We have 3 children and we can't do that. But if you look at him as a now 37-year-old, he doesn't look like he has a medical issue. So often he's refused entry or he's treated unbelievably rude and discriminated against when he says that he has a medical exemption. Now, for myself and our 10-year-old son, we both have major anxiety over suffocation, among other things. But I've had this issue since as long as I can remember, but it's never been a big issue because I was never required to cover the only 2 places in my body where I can breathe. But as I would try to follow the mandate in the early days, I used an oximeter and found that even while sitting down, my oxygen levels dropped and my heart rate would spike. And then the day came when I almost passed out while sitting down while I had my 4-year-old child with me. And so from that day forward, I have refused to put myself and my children in that situation again. But to look at me or to look at my 10-year-old son, it doesn't look like we have any issues. And therefore, both of us have been discriminated against and refused entry into certain places. And worst of all, my son this fall was refused to be seen in his own doctor's office building because he couldn't wear a mask. And the doctor's solution was to meet us in the parking lot by the building, where they offered to hold up a sheet for my son to take off his clothes so he could do the exam. A doctor who is supposed to uphold privacy laws and do no harm wanted a 10-year-old boy to disrobe in a public place because of the madness that this mask mandate has created in people. We did not accept their offer, by the way. This mandate is unnecessary, socially and economically damaging, and has created undue hostility and anxiety for an illness that statistically has a 99% survival rate for those under the age of 70. The true least restrictive measures would be to allow people to function as they see fit, to end the mandate and let people choose what is best for their own health. Thank you.
Gretchen, go ahead.
Hello, my name is Gretchen Reed. I live at 862 North 1884th Road in Lecompton, Kansas. I just have a couple comments on some of what I've been hearing, and just to piggyback on what Nicole just said, I think we need to consider at what point is the damage of these restrictions going to outweigh the impact of COVID. You know, she just stated it has a survivability of 99%. Okay, some of these other things that we've been hearing about, psychological issues, businesses not being able to survive, those have 100% death rate. Like, you can't come back from that. So I think at some point you need to decide which is the greater threat here. I also want to comment on Dr. Scrimshire, something she said, just that transmission is dependent on individuals being sick. Okay, being sick. For 9 months plus, we have been masking healthy individuals that cannot transmit it because they are healthy. Healthy individuals should not be masked. And then just commenting on the most vulnerable, the last time I looked at KDHE website, the most vulnerable are those 65 and older. And in Douglas County, they have all had the opportunity to get the vaccine now. I'm a simple person, and I guess just looking at the stats that I have seen, hospital rates are at a manageable level. He also mentioned this, that they're not even close to overrunning the hospitals. Case rates and positive cases have been declining since January. 6 to 8 weeks of data show that the county is stabilizing at 8 to 10 cases a day. We're not going to get to 0 cases a day. All right, COVID's not going away. We're going to have to live with it. Also, Douglas County is the highest vaccinated county in Kansas. Last time I checked, we're on phase 5. At this point, everybody that wants to be vaccinated has had the opportunity to. There are schools in the county who've been operating in person nearly all year with few problems. And like I said, COVID has been with us for over a year. We should know how to treat it and what to do now. In my opinion, we have reached a livable level. Life is not risk-free. We cannot live how we are currently living forever. It's time to let the citizens of Douglas County choose what mitigation strategies they want to implement for themselves and their families. I believe in personal health choice, and that's what I'm advocating for today. Thank you very much for the opportunity to speak.
Stephanie, go ahead.
Hi, my name is Stephanie Ziegler. I live at 1576 East 767th Road, Lawrence, Kansas. Fortunately, my son has gotten to go to school all year, and every day I drop him off and he has to put a diaper, is what I call it, on his face. And I see little kids walking into school with this mask on their face, and it breaks my heart. No one that I know of has died from COVID, especially a child, but I know several, probably 4 or 5, that have committed suicide or been struggling with alcohol or drug abuse. I advocate for health. I'm try to be very healthy on a daily basis. And I encourage our commissioners and the people to let us make choices around our personal health. Thank you for your time.
Tate, go ahead.
My name is Tate Jansen. I live at 1705 Carmel Drive. First, I just want to point out that by definition, according to the World Health Organization, the way you're intending for a mask to be worn considers it to be a medical device. So basically what you're wanting me to do is to consent to wearing an unwanted medical device. I don't think that is something under my constitutional rights that should be allowed. I mean, what is next? Are you going to require me to take psychotropic drugs because you think I should change my behavior that would benefit the public? That may be extreme to you, but I think it falls within the same analogy as what we've heard from some of the doctors earlier. Next thing I want to point out is there wasn't given an exact amount of or percentage of people vaccinated before this mandate gets rescinded. So I just wondered if Dr. Scrimshire, since she's still on, if she could comment maybe on what percent they're looking at before they would want to repeal this mandate. And she's basically made the comment that as vaccine rates get higher, but the CDC says that we should still wear masks even if you're vaccinated. So there's a little bit of a conflict there when she says when we reach a certain vaccination rate. And that is all I have for tonight.
Stella, go ahead.
Oh, sorry. It's actually Brian. I'm not sure where the name Stella came from. Can you hear me?
We can hear you. Please go ahead.
Okay. Brian Slough, 1738 East 1675 Road, 66044. Thank you for letting me comment tonight. I think everybody that has come on to comment has had a lot of great points and bring up the issues at hand that are affecting our community, And I think to not, summarize what they're saying, but more put the words out there that I guess I'm thinking regarding the mandate. One of my concerns that comes with this is the terms used in the mandate for the amount of people that are allowed in a business, and you ask people to opt out of compliance. I think that's an overreaching term. And at the end of the day, it should be either you follow a recommendation or you don't follow a recommendation, but put undue burden on businesses to, first of all, advertise that they're opting out of a so-called compliance, which if it's compliance, why would we be opting out of it? And then the other part of that is, I think a gentleman brought up the issues with how it might affect perception in the community, and considering the reactions from people within the community, specifically to people without masks on. I myself have been into multiple businesses and had unfortunate incidences where people are rude and inconsiderate of me being a healthy person and not able to wear a mask. And at times being refused service. I've also been refused to let my 4-year-old come in because I refused to put a mask on my 4-year-old because the state mandate is not understood by the businesses that are trying to administrate them. And I think at the same time, I would apply that to the mask mandate side of this. I think it should be a recommendation from the county or from the state, and as adults, we are able to make decisions about our own health. It's a very important individual liberty in our country, and our ability to make those decisions. Anybody that is of sound mind should be able to manage their own health as my body, my health. And I think that's the basis of our individual freedoms and our ability to interact with each other and ensure a good, healthy community, because we do take care of ourselves. And so I think you're undermining the actual point of what it means to be free in America. I think as representatives, the county commissioners, you represent us, but you don't rule over us. And that's a very big part of that freedom, is that you represent us and you give us support, but you don't dictate day-to-day how we operate day-to-day with in terms of how we manage ourselves. Sorry, I might carry on a little bit there. And then the other side of this, I think, is concerning, is that there are statistics out there that have been represented in this conversation tonight. I think the KDHE was brought up, and we're talking about how much areas with mandates and areas without mandates had infection rates. And I think it was maybe the Sentinel that exposed that wasn't represented accurately at first, and it wasn't represented accurately tonight. And unfortunately, that becomes a big conflict of interest for us that are looking for how you represent us, because if you can't get accurate information and statistical
We're
data
over 3
that's
minutes.
accurate.
If you could please wrap up.
Okay. And so if you lose trust in the electorate, excuse me. So I guess at the end of the day, I think none of this should be a mandate. It should be direction from the health department, and the impact on our community has been great. I think people have voiced that concern, whether it's been mental to both children and to adults alike. And it would be nice to open up Douglas County and get back to what we were before.
Emily, go ahead.
Peterson, 1130 New Jersey, Lawrence, Kansas. I also own Merchants Pub and Plate with my husband, TK. And I would like to maybe bring another perspective to the conversation. I am really proud of where we are with our local health. The vaccination rate is amazing. And I think if we were truly only talking about what's happening with our community members in the community, I would probably have a different perspective. I would be ready to loosen restrictions as well, because there are so many challenges with the restrictions. But I'd just like to bring your attention to where we are in the KU school year and what it looks like right now when we have people visiting downtown from all over the country on a weekly basis. I don't know if you're familiar with the KU Panhellenic schedule, maybe not, but it used to be that there were moms and dads weekends for sororities and fraternities, and they'd occur like over 4 weekends in the spring. Well, what they've done is spread those out, I think, in response to COVID, to try not to have so many people in town at once. But that means that every single weekend until the end of May, we have huge numbers of people traveling in from other locations. And, you know, certainly lots of activity downtown, people going in and out of businesses. And we certainly don't know what the health of that traveling community is and how that impacts our local health. We also have 2 KU graduation weekends this year, which you may not know. So looking at, you know, the rest of April and into May with Mother's Day, KU 2021 graduation, and then KU 2020 graduation, it really feels like until we get to the end of May, we're gonna have a very large population of people from outside of our community impacting our public health. And I think it's really problematic for businesses to potentially be operating under different restrictions, especially for people visiting who don't know how to navigate those different businesses, who may not know where to go for information about those different businesses. And so I want to say that I support continuing the local health order as it stands, and I would encourage you to look at an end of May date for revisiting so that we can get through these weekends with very, very large numbers of visitors from out of city, out of county, certainly out of state. Because I'm concerned that's going to, you know, really take a bite out of the progress that we've made. That's all I've got. Thank you.
This is Commissioner Portillo. I believe that that is our last person for public comment. Sarah, can you just confirm for me that we don't have anyone else at the courthouse? And Jill, if you'd confirm that we don't have anyone else online.
We don't have anyone else here for public comment.
I apologize, Commissioner Portillo. I do see, I'm going to move 2 more folks that raised their hand. Benita, go ahead.
My name is Benita Yoder. I pulled the van over. I've been listening to some of this, but you know, I know people who have hearing issues, and the masks make it difficult to understand. And I know myself, I have a little hearing loss, and it's not enough that I need aids, but with the mask, with my having a mask and other people having masks, I know grocery store and bank teller and different things, I'm often asking to repeat, or somebody's asking me to repeat, or it just, think that it would be, I am in favor of having people have the choice about making a mask at this, wearing a mask at this point. And I know I didn't have an opportunity to listen to the entire presentation earlier, and I was driving some, but I have seen some things that have different interpretations from a scientific viewpoint. And I just wanted to state that I am in favor of having those restrictions on the mask mandate loosened at this point in time in our county. Yes. And that's all. I didn't plan to talk. I didn't prepare the talk, but I just wanted to speak from my personal experience and that of some other people I know who it's the mumble. And when they're making business transactions. So that's it. Thank you.
Judy, go ahead.
Can you hear me?
We can. Go ahead.
Okay, I'm Judy Carmen. I live at 312 North 1925 Road in Lecompton. And I'm respectfully asking you all to lift the mask mandate. I sent in some information with a link to this research, policy research article, which was the authors of that article had looked at a large number of studies that have been done and concluded that face masks are ineffective at preventing the spread of a virus. They noted, among many other findings, that, quote, in Kansas, the counties without mask mandates had lower coronavirus infection rates than the counties with mask mandates. Then there was another one, I just picked out a couple. Quote, in many states, coronavirus infections strongly increased after mask mandates had been introduced. And then there's charts in the article that I sent, the link that I sent to you. So the charts show the typical examples of Austria, Belgium, France, Germany, Ireland, Italy, Spain, the UK, California, and Hawaii. And those charts showed that the mask mandates did not make any difference. In addition to that, I agree with many governors, physicians, county commissioners, and others who have refused or lifted mask mandates because they are not only ineffective and in many cases, as we've heard tonight, very harmful to a lot of people. But it's also an unconstitutional violation of our freedoms to choose and an abuse of our rights to informed consent and bodily integrity. Another point I wanted to make is that many people are boycotting stores that are requiring masks in spite of the state of Kansas lifting the mandate. These stores would appreciate your voting to lift the mask mandate, not just for their business, but also for their employees, some of whom have respiratory problems that are greatly exacerbated by wearing masks, as we've heard about that too. There's so many reasons to lift the mask mandate, including regaining our freedom to bodily integrity and giving children back the freedom to play unhindered by masks and to see each other's faces and get back to living in a free country. We need to see each other's smiles. And that's all I had. Thank you.
It looks like, I know that the name was changed, but it shows up as Stella. Is there another individual in your household that would like to speak? I see your hand is raised.
Yes, please, if I could. This is Brian's wife, Trisha. And I just wanted to say, from everything that I've heard tonight, the benefits no longer outweigh the risks. And I specifically wanted to comment on, somebody saying, well, let's just wait until after graduation, and I feel like that has been ongoing with this mandate. Let's just wait a little longer. Let's wait till one more event. It needs to end. And you really need to give us some finality on that. People need to be able to go back to normal. Our kids, my kids need to have normalcy. The anxiety, the economic issues that we are starting to really feel and see in our community are real. And we need your help to advocate for us in this. That's all I have.
Okay, and then I see Brendan.
Yes, hi everyone. Sorry I don't have my video. I wanted to hop in. I am a graduate teaching assistant at the University of Kansas. I will be returning to work in person in the fall. I think that the mandate is still quite essential as somebody who will be working with multiple people in a mass setting. We still don't have even 50% of people fully vaccinated. And it's been proven time and again that these masks are helpful in reducing transmission. They're helpful in reducing severity of disease. They protect not only the outside population, but also the wearers. And so, I recognize that, yes, it causes a lot of anxiety to wear these masks. It can be very uncomfortable. But I think that, even though it's been, we hurry up and wait, it's still better to wait than to risk having a really serious outbreak in the community, especially coming up on the fall with lots of new students who may be coming to the community. I think it's important to keep everyone safe, and that these masks are a great way to do that. So thank you.
It looks like that is everyone.
This is Commissioner Portillo. Thank you, Jill.
Commissioners, I do have one more person here at the courthouse that would like to provide public comment. Please state your name and address.
My name is Lavina Tooley. I'm at 121 Providence Road, Lawrence, Kansas 66049.
I'm sorry, we can't hear you. Could you speak up a bit?
My name is Lavina Tooley. I'm at 121 Providence Road, Lawrence, Kansas 66049. And I just wanted to speak a little to getting back to what and how we started. I think we've gained so much momentum, we've lost our path, and fear is now driving some of the decision making. I think if we think back to what we started with was just, let's keep the hospitals to where they can still get to people who really have heart attacks and breaks or COVID or something, or needs extreme responses. And we were all doing our part to keep those counts down. It was initially doing your part to not wear a mask so we could save the masks for them. This was all about helping the ill. And if you're helping the ill, then, and you feel that you are working with the ill, or you are working with people that are in nursing homes, or you're working with people that have chronic illness or having cancer treatment, you're at a hospital, all your PPE is completely warranted because you're protecting the ill. We have never done this for the healthy. We have never used these things. You don't, I'm a physical therapist by education. I'm a business owner now. You don't, you work and you give and you make yourself uncomfortable in your line of work to help those that don't have those capabilities. This progression from even when things were really bad, we're actually getting tighter as we go, even though things are getting better. And it's a virus. We're not going to outrun it. It's always going to be around. Just like there's always going to be flus, there's always going to be coronaviruses. We've had colds, we've had SARS-1, we've had MERS. Things are going to, it's part of our biodiversity, whether we like it or not. And our immune systems are perfectly capable of handling things if you're well. But some things that would injure your health is staying inside, not getting your sun. Some things that would injure your health is not moving, not walking your dog, not playing with your kids. My personal story is my son was already, even though I'm here in Lawrence, was already going to Perry for other reasons. My daughter, I live right by Deerfield, like she can walk to school, but she wasn't in school. And after several months of doing online, and I'm sure there's a lot of parents, and a lot of parents may not mind, but I do, my daughter started saying she hated school. I don't care if she learned this year. I don't care if we repeat the whole year. But if you lose the love of learning, if you go automatically, she's only 10 and she hates school and she doesn't want to go to school and she doesn't want to participate because she was sitting there. We are a very active family. We take a lot of pride in being active. And this thing has shut, of course, everyone down and no play dates and socially. And this is a 10-year-old girl completely depressed. This was not help. Now you're making my family sick. And now I'm to protect everyone else. We're making everyone else ill. I think we have to get back to why we originally did this, what our mandate was, what our ethical, moral decisions to protect those that were ill, which is still correct and still in line, and let the rest of us go forward. Humanity has to keep moving forward, has to take responsibility now for their own choices. We have to be allowed to make our own choices and have our own responsibility. So I think this mask mandate has to be rescinded, or at least made minimalized in some way, shape, or form, so that we can be with each other in ways that we feel safe. And each person's going to feel safe in their own way. And if they still want to wear masks, well, good for them, put one on. But for those of us, for example, in my business, we're exercising. I need to see your face. I need to see your breathing. I need to see if your lips go blue. I need to see if we're having distress. I can't see any of that. And half the people in my gym are pulling it off the entire time anyway, because they have to breathe. So now they're handling it, which kind of grosses me out anyway. I mean, I think most dentists can agree, you don't fiddle with mouth goo. So you're not making me safer. If anything, not because I'm afraid of COVID, but just whatever other bacteria, fungi, everything else that lives in our environment. This is not a natural way to be. It's not a natural way to be healthy. And we just need to move on and remember why we did this in the first place and continue protecting those that need protection and let the rest of us move on. Thank you.
Bill, we're going to close public comment on the mask order unless, are you here for that? Are you here for public comment on the mask order on the new? Okay, great. Okay, it may get moved. Okay. That's all we have here at the courthouse.
Thank you, Sarah. Jill, do we have anyone else online?
No.
Thank you. This is Commissioner Portillo. We'll bring it back to commissioners for discussion. I also think it's important that there are a few just kind of factual pieces that I would love to get our presenters feedback on. I think one is really around funding for the Centers for Disease Control and this idea of information literacy. How do we evaluate studies? How do we evaluate the kind of information that we're reading about? Since we know there are lots of different places to get information. We heard a bit of that in our presentation, but I think it'd be important just to kind of hear a bit more on how our public health evaluates information. And if you could just give a quick primer on CDC funding for folks, I'd appreciate it.
The question was around CDC funding for response to COVID. Did I get it correct? So we've received so probably 4 or 5 different grants from KDHE that they've received from CDC to help support COVID response. We've just finished up spending the last of those grants, and the work still is in front of us. Overall, that's probably close to $2 million if I had to just spitball what that number is. But we've gone from a staff of 45 to a staff of over 70 just to ramp up with disease investigators and people to man a call center. And so we've been given a lot of resources. Yes, go ahead.
Dan, the question was more of who funds the CDC, not what funding you receive from the CDC.
Well, your tax dollars.
I just think it's important to point out the public funding at the CDC, because I think we've heard kind of quite a few different discussions around where that funding comes from and the importance of public funding when we talk about public health. Commissioners, I didn't invite you all to open it up to conversation as well. Do you have additional questions, comments, or discussion around the health orders in front of us?
This is Commissioner Kelly. Just have a question on, in the order, it says that all businesses must maintain 6 feet of distance. And then if businesses choose not to follow the 50% rule, they can opt out. Can you talk about why you recommended, you mandated your recommendation is to mandate the 6 feet of distance, but they can opt out of the 50%. We heard a question about that, and that's just I'd just love to hear the thinking behind that.
And I can let, as Brad Finkel, I can let the doctors weigh in a bit. One of the issues is around the least restrictive, a least restrictive order. So there's a lot of science around the 6 feet and the social distancing. There's not a lot of science that says 51% or 49% or 60% or 48%. And so the 50% is a useful guideline, especially in enforcement of the order. But the science isn't quite there on why 50% is better than 51 versus 49. And under SB 40, in adopting the least restrictive, we felt that we wanted to base it on the science of the 6 feet, as opposed to kind of what some would call an arbitrary 50%. But if the doctors want to add to that, they can, but that's kind of the basis for that.
So if oh, go ahead, Marcelino.
You go ahead, Jen, go ahead.
Oh, I just, like I said earlier, I mean, in my head, I think, well, 36 square feet per person, but that doesn't take into account the family of 4, like, because they're all together, or the table of 10 or whatever. So it's just a different way to de-densify a space.
Yeah, I think Brad made a good point too, that the 6 feet of distance really is the key between parties. And, you know, businesses are set up differently. They have different capacity. They have different setups. You know, one business maybe have more airspace, more space between tables, but other businesses may be more dense. So really the important number is the 6 feet. The 50% really has always been a guide to help businesses. And we're trying to help businesses to achieve a safe environment. And that 50% is kind of a guideline. And usually if you follow that 50%, then you're setting yourself up to be distanced appropriately. But you know, there are unique businesses, and they may say, well, we can have more than 50%, but we're still going to achieve the 6 feet of distancing. And we're not trying to alienate or shame those businesses. And you know, that's why if you're opting out of the 50%, you know, that may be for a reason for your business, but you're still going to be complying with the 6 feet. So, you know, the public needs to keep that in mind too, that, you know, you want to go into an establishment and be able to find a place where you can sit 6 feet apart from the other party. And if you can't, then you may choose to go to a different establishment.
Thank you.
This is Commissioner Reed here. I'm thinking about what enforcement looks like and what it has looked like. And I think it's an ongoing conversation. And, you know, earlier it was mentioned that, excuse me, these health orders are, I mean, they're like the ones that have existed in the state before this Senate bill, and that have existed here in Douglas County. And I just, in hearing and having conversations this week with lots of folks about their personal choice and feeling discriminated against in public businesses, and things like that, makes me think about, you know, about enforcement and how, in my experience, there is, it's each individual business owners and there's employers who decide whether or not what their degree of enforcement for their business is, right? But I'm curious if the health department and legal counsel perhaps has some contributions to this too, can talk about what mechanisms exist for enforcing this order. You know, what is that complaint based? Is it, what are the potential consequences? I'm just curious about some of those things and wonder if that would help with a public's perception of the health orders and how they function.
Well,
Commissioner Reed, go ahead, Dan, if you want.
Well, I just was going to try to toss it over to Brad because Senate Bill 40 creates new enforcement mechanisms that I think legal counsel can best describe.
So I would make a couple comments. As orders, you know, since this started in March, different orders have been in place in different times. And I can tell you that, you know, the mask mandate order is typically not enforced against a person. It's enforced against a business who chooses not to follow the order. Now, if there was no mask mandate in place at all, of course, an individual business can do what they want, you know, just like they say you have to wear shoes to come into my business, they could say that. So regardless of the order, a particular business can do that. But if under this order, if a business did not comply with that, then it could be enforced. Now, enforcement against businesses over time, for example, the closing time, the commission knows we've attempted to enforce that. We've been sued by several businesses, and the question of the ability to, for example, shut down a business has been not as clear as one would like in the statute. Or with SB 40, they also have not made it clear what the powers all explicitly, like it doesn't have an enforcement section, like here is how you enforce it. But SB 40 does say that if the health order requires masks, affects the operations of business, affects movement, then we have to go through this process. So by implication, that's the clearest method we've had that a health order could be enforced that way. That being said, Dan could talk more about what we've done as the health department, but typically the warning letter sent, first warning letter, a second warning letter, and typically we've had compliance as we've put people on notice. We have great business owners who have been complying. So I guess that would be my thoughts, but I could answer more specific questions.
No, that's really helpful, Brad. Thank you. I think that thanks for talking about Senate Bill 40's kind of language around that. And I think what's helpful for me about that, and what I hope might be helpful for other people, is that mask mandate, it's enforceable against businesses, and on the other side of that, it offers businesses an opportunity to lean on that health order and that and what's prescribed in that in order to really maintain a safe environment in their business as they see fit. And so I think it's an important distinction that mask order is not something that is individually enforced upon individuals who cannot or do not want to wear masks, and that much like shoes, as the example is given, or really any number of things, a business owner or its employees can refuse service to anybody for any reason, quite frankly, is my perception of that. And I'm interested in thinking about informed choices. So in thinking about the opt-out option, I'm trying to think through that a little bit. I thought that seemed like a good option and something that businesses would appreciate the opportunity for. And then it gives a mechanism for creating public notice so that consumers can make informed choices. And then hearing some of the public comment about expressing some concerns with that makes me wonder if anybody can give us a sense of where that piece of the recommendations came from, and what that where the opt-out option came from, and what the thinking behind that is.
I'd be glad to try to answer, and then obviously if Brad wants to or Dan want to follow up. I think as we've approached this order, I think it was from some of the things that were mentioned earlier. It's the 50% capacity is hard to completely tie down. And the new Senate Bill 40 requires the least restrictive. There is science behind 6 feet apart, and that is in the order. The notion about 50% capacity, it really depends on the size of the building. So because of the way that the order was required us to be least restrictive, we felt that this opt-out option provided that opt-out, so it would be least restrictive. And I think that's really the only way we can say it, is that it's difficult to sort of legislate the 50% capacity, but it has been helpful for some businesses. But Senate Bill 40 no longer cares about what's helpful. They care about what's least restrictive. So it's been a delicate balance between the legal side of how to approach an order and the medical side of what we're seeing from the studies. Does that help?
It does help. Thanks, Sarah. And just to be clear, I don't think it's spelled out, and based on our earlier conversations, I don't think there is a particularly formal process for that, but there is, it is a completely voluntary option for business owners if we were to pass this as is, right? There's not a criteria that needs to be met. There's not like a justification that has to be made or put in writing. It's a simple voluntary opt-out. Is that accurate?
Yes, for bars and restaurants.
Got it.
Where
Thank you
masks are taken off. Yes.
Thank you. I don't have any other questions if other commissioners do at this time.
This is Commissioner Portillo. I did really appreciate Emily Peterson's comments about commencement. So KU does have 2 commencement weekends this year, one for 2021 commencement and one for our 2020 commencement. The way that this health order is written, there would actually be the potential of 2 different health orders because it's right as those commencement weekends come into play. So I would suggest that if we take this health order if we move forward with this health order, that we just keep this through the end of May so that we get through both commencement weekends with the same consistent health orders for folks to not have to switch things up between those 2 weekends.
Are there thoughts amongst, Brad, I don't believe Senate Bill 40 requires any particular time. It just requires regular review, if I'm remembering correctly.
It actually requires an expiration date.
Okay.
To the extent it have to be renewed. It does not, of course, mean you couldn't review it beforehand if you wanted, but we do have to have a date in there. And so certainly, obviously, given your schedule and that you have to approve it, probably a date on which you meet. So maybe May 26th would be the next Wednesday, if that's a meeting date for you. And that obviously that's your choice.
This is Commissioner Kelly. Can you talk why you decided the 19th? I mean, was that just a month away? Is that what your thinking was? Okay. No magic behind. I'm seeing head shaking yes for those of us that are listening. So
yes, there's no magic to that date. I mean, clearly, if the number is warranted, at any time you could bring it up on an agenda and withdraw it. But on the other hand, we didn't want to put it so far out that didn't give a chance for meaningful review.
Great, thank you. Commissioners, if there's no other questions, I appreciate everybody. Maybe we could have some discussion and maybe get towards a motion here. But I appreciate everyone who came out and shared with us. I know there's a lot of passion around this, and there's a lot of thoughts around it. And I appreciate everybody who sent us emails and let us know what they thought. In listening to the evidence that was presented by Dr. Scrimshire and Dr. Marcelino, I feel confident in this order. I am sure there are some things that we may like to tweak. And so I like the May 26th. I mean, I guess we could have gone all the way to July. So it sounds like that we really didn't have to stop a month later, but I'm sure there's lots of things people would like to adjust here and there. And I feel confident that in a month we'll know a little more as we work through it. But I do think I do think there's plenty of evidence and reliable evidence from my research. I read a lot of the links that people sent, and I'm not as confident in some of those sources as what has been shared from the CDC and the NKDHE. And so at this time, I'm comfortable with the order as written, but I'd be interested in hearing other commissioners' thoughts.
This is Commissioner Portillo. I appreciate that, Commissioner Kelly. I do think that I also read a number of the links that were sent to us. I would say I read all the links that were sent to us. And I think it's incredibly important to think through how medical expertise plays into this. I appreciate Dr. Scrimshire and Dr. Marcelino's discussions of how their background, how their education prepared them to consider the evidence. I think it's also really important for us to consider where evidence is coming from. And so I do appreciate what the CDC as a publicly funded institution is providing, as well as our own health department here in the state of Kansas. I think that it's been really clear to see the evidence on masks and how masks slow down and prevent the spread of this respiratory illness. And as we're still in a phase where we're trying to ramp up vaccination, and as we're still trying to ensure the safety of folks who aren't able to get vaccinated, particularly adolescents. I think it's important that we continue our mask mandate in our community. I do want to see a bit more kind of information around the implementation of opting out and how we do make sure that the public has that information so they can make informed choices. But I recognize that that doesn't necessarily need to be within the order, that we can have our administrative agencies take care of the implementation piece of it. But I would consider approving this with the May 26th date so we can get through commencements at both of the commencement weekends for KU and not have two separate health orders.
This is Commissioner Reed here. I would echo both my fellow commissioners' comments, and I feel comfortable with what's been brought to us and as it's written right now. And I also feel comfortable with pushing, excuse me, that expiration date out just 1 week for all the reasons already stated. And I think I also really want to thank everybody that took the time to send us comments and thoughts. And I mean, I think we got a really quite a few really thoughtful and personal and passionate communication. And I think that there's a lot of hardships and issues that that are valid and that have had huge impact on people's individual lives and their families and their interpersonal communities. And I want to hold space for that and know that those experiences are real and they're valid. And at the same time, we have to look at a community-wide perspective and really think about what are our responsibilities to promoting public health and specifically reducing harm. And for me, that's a praxis, and the lens through which I look at any issue is really wanting to look at it from a harm reduction point of view and what is possible for in any given situation to reduce and mitigate the potential for escalating harm. And I think that this order does that effectively. And it maintains people's ability to make informed choices. So I appreciate the opt-out option for that piece of it. I think that it's a way for business owners to make choices about how they want to conduct their business. And it's a way for consumers to have public notice and awareness about which businesses they feel comfortable and safe enough to go to. So for me, informed choices and harm reduction, and then ultimately really community care are the central reasons that I think this is important and necessary for us to do while we maintain vaccination rates that are something to be proud of, and there's still work to be done. And so, and then I just agree with Commissioner Portillo that I think we really do need to be mindful of what the opt-out piece of things look like. And I really liked the idea at the top of our conversation about making sure that that's something that's very easily findable on our website, or on the Public Health Department's website rather, and the COVID dashboard, so that we can promote that there's a place to go seek out that information. And conversely, for business owners to know how to participate in that process and get their questions answered.
Go ahead, Commissioner Kelly.
Oh, no, go ahead. It's fine.
I was just going to say, this is Commissioner Portillo, and I would like to move that we adopt this emergency health order with the update of an expiration date of May 26th.
So I'll go ahead and second that. I just want to make one more comment. First, Commissioner Reed, I really appreciate your language around validating people's experiences. I really think that's important when people come to us with concerns, and it honors those concerns and those experiences. I think I really felt for Mrs. Vanacola. I hope I got her name right and what she experienced. So thank you for saying that. The one thing I would say, I would ask, and this probably is best through unified command, to do some work with our Chamber of Commerce to help businesses understand what is in the public health order and what their options are within the public health order. And I think we have a nice structure to do that, to help inform folks regarding the exceptions and the opt-out options there, and how to make it as easy as possible for them. So I think I seconded that first. So
Thank you. We'll bring it to a vote. All those in favor, please say aye. Aye.
Aye.
Aye.
Thank you.
Thank you, commissioners, and we will follow up on the particular procedures and how we will outreach to the community on that.
We appreciate that. And I do just want to say a huge thank you to John and Brad and Dan and Dr. Marcelino and Dr. Scrimshire. We really appreciate it. Dr. Scrimshire, in particular, just want to say thank you for providing so much evidence and all of the data that you did bring to the commission that really helped inform our decision, and or my decision at least. I really appreciate your careful consideration of the data.
Commissioners, before we move on, if I could interject, it's been a long night, and we do have a couple of other items that we do really need to consider tonight, but we have some items that could be moved to a later agenda. It might be helpful now to sort of let folks know what we plan to do for the rest of the evening, and so that they can make their plans accordingly. I have had conversations with Sheriff Armbrister. His presentation can be moved to next week. And as well, our presentation from our legislative liaisons, Little Government Relations, could also be moved to next week as well. We do need to hear the planning items and the health plan tonight. And so I guess my recommendation to the commission would be that we would table those two items towards the end of our agenda, and but continue with the others.
I appreciate the kind of schedule maintenance, and I really like that plan. Could we table the sheriff's item as well as our legislative update, take a recess until 8 p.m., just give ourselves a quick 8-minute break, and then pick back up with our two planning items and the health plan?
Yes, absolutely.
Does that work for my fellow commissioners?
Yes. Is there a motion required for deferring? Okay.
No.
Okay.
Is there a motion required for us to recess until 8, or do we just have to say we're recessing until 8?
Correct.
And Dr. Scrimshire, I did see your hand up briefly. Did you want to? Oh, you're good.
You're good.
Thank you for joining us. We appreciate it. And we will be in recess until 8, and then we will pick up with our planning items.
Thank you.
Thank you. 8 p.m. So welcome back. We will move on to our second regular agenda item. Item 4.2, Public Works. Sarah, do we have a presentation on this item?
Yes, commissioners, we just have a few brief comments. Kevin Sontag and Public Works Director Chad Voigt are joining the panel. Kevin, take it away.
Thank you, Sarah. Let me this up here. All right. Good evening, commissioners. Commissioner Kelly, it's nice to see you again. Commissioner Portillo and Commissioner Reed, my name is Kevin Sontag. I'm the county land surveyor. And even though it's not in person, it is nice to meet you. I'll try to blow through this as quickly as I can in the effort to save some time. I'll start with a little background information regarding minimum maintenance roads. First, some definitions of what a minimum maintenance road is. The Kansas statutes quote, when the Board of County Commissioners of any county is of the opinion that a road within the county is used only occasionally or is used only by a few individuals, the board may commence proceedings to declare the road a minimum maintenance road. Whenever a road has been declared a minimum maintenance road, the state, the county, and the townships within such county shall be exempt from liability for any claim by any person under the Kansas Tort Claims Act with respect to such minimum maintenance roads. No such governmental entity or employee thereof shall be liable for damages arising from such roads or their maintenance or condition, end quote. In short, the road remains a public roadway, but the maintaining agency does not need to maintain the roadway if they do not need or want to, and certainly not to everyday standards. Douglas County Home Rule Resolution 92-10-2 established guidelines for what roads could be eligible for minimum maintenance designation within Douglas County. The guidelines include roads in which the daily traffic volume is less than 24 trips per day, roads where the primary use of the road is for low-speed agricultural vehicles, and roads where residences have an available alternative access from a full maintenance road. Lastly, County Code Section 9-501 states, no entrance permit other than a field permit may be issued for entrance onto a public road that is then designated a minimum maintenance road, where a field permit is defined as for an entrance which allows access to a public road only for agricultural purposes, but not for purposes of access to a residential building. Now on to our specific item, E650 Road between County Route 442 and N1550 Road was originally opened in 1916 as a public full maintenance road. The maintenance for the road falls under the jurisdiction of Kanawha Township. The road remained full maintenance until 1992. At that time, the full half-mile stretch of the road was officially declared minimum maintenance by the Board of County Commissioners. 13 years later, in 2005, the northern 550 feet of this road was reverted back to full maintenance, with the remainder of the road, which is the subject of conversation tonight, still being designated minimum maintenance. Since the minimum maintenance declaration in 1992, 3 residential entrances have been added to this minimum maintenance road segment. This is, of course, a problem, as residences should not take access from a minimum maintenance road. 2 of these 3 residential entrances were actually approved to be from full maintenance road segments, but were either mistakenly or purposely built by the then landowner on the minimum maintenance segment. The 3rd entrance was approved as a grandfathered parcel that once had a house on it many years prior. A movement should have occurred to rescind the minimum maintenance designation at that time, but none was made that we know of. Since these 3 houses have been built, the road has been maintained by Kanawha Township so that residential traffic can safely travel on the road, but it does technically remain a minimum maintenance road. We now wish to correct the situation by rescinding the minimum maintenance designation and making this an official full maintenance road again. A hearing regarding this road was held at the Kanawha Township monthly meeting on October 13th, 2020, and the Township Board of Highway Commissioners unanimously recommended that the minimum maintenance designation should be rescinded. Their certificate of opinion was given to the Board of County Commissioners at their November 4th meeting, where the commissioners, by consent, directed Public Works to proceed with preliminary work towards rescinding the designation. That preliminary work resulted in a resolution signed by the board at their November 18th meeting that requested a recommendation from the Lawrence Douglas County Planning Commission. At their February 24th, 2021 meeting, the Planning Commission voted unanimously to recommend that the minimum maintenance designation should be rescinded. That brings us to our hearing tonight. A resolution is being presented to you that would officially rescind the minimum maintenance road designation for this segment of East 650 Road. After taking public comment, if any, we hope the board will approve the resolution. However, if you feel the resolution should be amended in some way, you can direct the Public Works Department to amend the resolution and bring it back to you at a later meeting. At this time, I'd be happy to answer any questions that you might have. Thank you.
This is Commissioner Portillo. I don't have any questions, but very nice to meet you as well. And thank you so much for that overview. It was incredibly informative.
Very good. Thank you.
Kevin, this is Commissioner Kelly. I don't have any questions, just wondering how the resolution doesn't have a number on it. So I don't know if we just make a motion to approve the resolution. But
Correct.
First, don't we have to have a public hearing? Isn't that right? We have to open a public hearing. Yeah.
That's correct.
Yes, Commissioner, just on resolutions, we normally don't assign resolution numbers if we can help it until after the meeting to make sure everything's done in the proper order. So I would suggest after your public hearing, the motion just say to adopt a resolution and such, you can outline the specific requirements.
Thank you.
This is Commissioner Reed. I don't have any questions either, but nice to meet your acquaintance, Kevin, and that was very informative and efficient. Thank you for the timeline.
This is Commissioner Portillo. Since there are no questions, I will open the public hearing and we will take public comment. Sarah, the lack of mask makes me believe that everyone has left you in the courthouse.
Correct. We have no one here for
Jill,
public
do we have
comment.
anyone?
Yeah.
No.
Thank you. Jill, do we have anyone online?
No.
Okay, so we will close the public comment and the public hearing on this particular item. Do we have any discussion from commissioners?
No comments, but ready to make a motion if you're both ready.
Sounds good.
I move to approve a resolution rescinding the minimum maintenance designation for a portion of East 650 Road in Kanawaka Township.
Second.
I will bring that to a vote. All those in favor, please say aye. Aye.
Aye.
Right. Thank you very much.
Thank you, commissioners.
And we will move to item 4.3 from the Planning Department. Consider rezoning Z21-00076. Sarah, do we have a presentation on this?
Yes, Mary Miller from the Lawrence Douglas County Planning Department is joining the panel for her presentation. Oh, we moved over the wrong Mary. I'll take care of that. Mary, okay, Mary, go ahead and you're in the panel.
Good evening, Commissioners. Mary Miller, City County Planner. And this is a bit of an unusual zoning application. The two of them I bring before you tonight, in that they're primarily housekeeping issues. The County Commission put a moratorium on certificates of survey and in the urban growth area while we were revising the zoning regulations. However, they allowed the ones that were in process to continue. And so as we worked through the process, two of them ended up getting finalized after the zoning regulations went into effect. If they had been finalized before the zoning regulations went into effect, their zonings would have automatically converted to the CP Cluster Preservation District. But since they were still processing, they're finished now. The land divisions have been finalized, but they don't have the CP zoning. And at the Planning Commission, one of the commissioners asked, what is the impact to the property owners if they don't have the zoning? Well, they become non-conforming. They can develop on it. It's not really a hardship for them as far as developing, but they may have trouble getting a loan on the property or insurance. And so staff asked that these rezonings be initiated. And that's why they're before you today. The first one is for approximately 35 acres. The certificate of survey was done and it has been divided into RDPs. And the request is for you to approve the rezoning to the CP or Cluster Preservation District so that the zoning matches that land division that occurred. And this was explained in the staff report, but I'll be happy to answer questions if you have any about that.
Any questions from commissioners?
No.
None for me.
We will open this item up for public comment. Sarah, do we have anyone for public comment in the courthouse?
We do not.
Jill, do we have anyone for public comment online?
Not that I'm seeing, just a reminder to use the raise your hand function if folks do want to make public comment. None that I'm seeing.
And so we'll open it for discussion amongst commissioners. Any discussion?
No discussion, just thank you, Mary. I know this was a pretty tricky one to sort of work through with the deadline, so thank you for cleaning this up. Commissioners, okay, I can go ahead and make a motion on this one. So I'll make a motion to approve the request to rezone Z21-00076, approximately 35.55 acres from AG1 Agricultural District to CP Cluster Preservation District associated with Certificate of Survey CSU 20-00045, located in the northwest quarter of Section 30, Township 12 South, Range 19 East, 1686 East 800 Road, and adjacent parcels.
I second that.
I'll bring that to a vote. All those in favor, please say aye. Aye.
Aye.
Thank you. We will move to Item 4.3, reconsider zoning Z 21-00077. This looks like it is a very similar discussion, similar presentation, but Mary, is there anything new we need to know about this one?
No, this is very similar. It's the same situation. It just got finalized after the zoning regulations, so staff is taking it through the process of getting it rezoned. Anything else that happened like this, people have non-conforming lots, they would need to submit their rezoning application, but we're just trying to clean this up since they were in process while we were changing regs.
Thank you. Do commissioners have any questions on this one?
No.
No questions. Thanks for sticking around all evening with us, Mary.
Sure. We will open this item up for public comment.
I still don't have anyone here.
Jill, I'm guessing you still don't have anyone who's raised their hand online?
No.
Okay.
Commissioner Reed here. I move to approve a request to rezone Z 21-00077, approximately a 19.85 acres from AG1 Agricultural District to CP Cluster Preservation District, associated with Certificate of Survey CSU 19-00546, located in the southeast quarter of Section 36, Township 12 South, Range 18 East, 785 North, 1550 Road, and adjacent parcels.
Second.
All of those in favor, please say aye. Aye.
Aye.
Aye.
Thank you all. Thank you, Mary. We will move to item 4.6, the 2021-2022 healthcare plan. Sarah, do we have a presentation on this?
We do. Our Human Resources Director, Michelle Spreer, is joining the panel and will give us an update on our health plan. Michelle?
Good evening. Well, in the essence of time, I'll jump right in. I know we did a work session, I don't know, a month or so ago. This is probably a little bit of new information. After that, we'll look at where we ended last plan year, kind of where we're at year to date this year, and then where we want to go going forward. So, so with that, let me share my screen. Okay, can everyone see my screen? Okay, very good. The 2019-2020 plan year, we ended about 9% below projected. We may have talked about this a little bit before at the work session. We're thinking that reduction is due to some delayed claims because of the pandemic. It is expected to rebound somewhat, whether it be by the end of this year or possibly into next year. Most things that were put off were elective surgeries. So, we just don't know what that's going to look like yet. So we don't want to hang our hat on that 9% that's going to be something that continues forward. Stop loss premiums. I know we talked about stop loss. Again, stop loss is exactly what it says it is. It stops our loss if we have large dollar claimants. Last plan year, we paid just over $1 million in premiums. Total reimbursements were $883,000. So we were cutting it pretty close last plan year as well. We had 4 claimants that hit our stop loss last plan year, and 2 claimants so far year to date this plan year. Those numbers are lower than what they've been historically. So that's a good thing. We do have a $195,000 individual or specific limit. So if any one individual hits $195,000 in paid claims, the stop loss vendor picks up and starts paying. Through February, our total plan cost, so your total plan cost are your claims, medical, dental, prescription, and then all of your admin fees, your stop loss fees, everything. We're running at about 87% of projected. Again, this is the time of year when people start to meet their deductibles and their out-of-pocket maximums. And so the plan starts picking up and paying a lot more about this time of year. So that 87% could easily turn to 95 or 100 or better. Some benchmarks on our funding: Douglas County, we cover about 76% of the total plan cost. 16% of that is employee and retiree contributions, so out of our paychecks, and then what retirees pay monthly. And then 8% is out-of-pocket cost in deductibles and co-insurance. So a little bit of history. This is a very busy chart, but this is a historical look at how our plan has performed over a number of years. This is not something we looked at last year. I had something similar to this when I was at the city, and it gives a really good snapshot of what the plan looks like. You know, talking about stop loss claims, you can see, well, 2018, 2019 plan year. That's a lot of reimbursement from a stop loss company when you only paid them $726,000 in premiums. So they lost a bundle on us. Unfortunately, we pay for that in future years. You know, if you look at the premium increases from 18 to 19 to 19 to 20, that's about a 47% increase in premiums. And if you annualize where we're at now, you're looking at probably about a 25% increase is what we're running on now. So this box down here at the bottom outlined in purple, this is a really good, it shows you what your total plan costs are, and then your budget accrual, or, revenues, I guess, so to speak, is another term. So you can see, I mean, we had 4 plan years in a row where our expenses outweighed our revenues. Not something you can sustain long-term, for sure. So like I said, 19 to 20 was a nice rebound year. But again, not something that happens very often. So the stop loss renewal, typically when we would bring this forward to you, we would have like stop loss all packaged up and ready to go as well. Because we've had some bad years in there, our current carrier did come back with a 20% increase and a $575,000 laser on one claimant. So a laser is just a higher limit on one or more claimants. So if that claimant has medical care that is not expected to end anytime soon, or these claimants have been on the stop loss large claimant list year over year, a lot of times they'll laser out those claimants. We're continuing, or Willis is continuing to negotiate with our current carrier, because we did get a firm quote from a new carrier that kept rates flat with no lasers. So Willis wanted to give our current carrier a chance to come back with something better. So they're still working on all of that. I know they've gotten some information yet this week, so they're still trying to package that up for us. So we'll have the final stop loss contract presented, by the end of the month, so you can see where exactly we landed on that. So this is great news. Nothing that we really expected at all. We were expecting a 30% increase with lasers. So that's not happening. So it's exciting. So projections going forward for the 21-22 plan year, Willis projects a 1.7% increase in total plan cost. Originally, that was around 6.1% when we thought stop loss was going to not be very pretty. So we're down to a 1.7% increase. That equates to additional funding needed of about $190,000. So this is on page 5 of your agenda packet. If you do have it pulled up, this chart is on there. So absent any plan design changes, so plan design changes are deductibles, co-insurance, out-of-pocket maximums, possibly taking away benefits or changing the way our plan covers certain services. So absent any of that, this baseline just is our current plan design. So to get to that increased funding that we need, you can take it out of any reserves that we might have. You can increase the dollars put in from the county. We can increase the dollars out of our paychecks, or retiree contributions, or a combination of all the above. But bottom line is you need an extra about $190,000 to run a balanced plan. So your revenues equal your expenses. With that, this is page 6 of your agenda packet. If you're looking through that, this chart is on there. What's being recommended would be a $300 increase to individual deductible and out-of-pocket maximum. You can see where it would take it down in the corner of this slide, just in case anybody else is horrible at math like I am. You can see where we're currently at with deductibles and out-of-pocket maximums. We're recommending a $650 increase in the family deductible and out-of-pocket maximum. That's a big jump, especially for this organization. Our individual and family deductibles and out-of-pocket maximums are so close together. If we're wanting to, and I know there's desire, from this commission to head down the consumer-driven healthcare plan models, we need to get those deductibles and out-of-pocket maximums further apart. I mean, you might have a family of 5 or more. It's a huge benefit. It is a very rich plan to have those deductibles, especially on the family side, so low. So we do need at some point need to get some space in there. So increasing those deductibles, and then a little bit of funding from the county, 0.2%, which is about $25,000. That would take the county funding to almost $9 million for this plan. No changes to dental or RX, and then no increase to contributions for employees or retirees. So making those changes would get us to where we need to be to run a balanced plan. So again, this is the recommendation. Also in your packet, and I know this is very, very busy, this is the last page of the agenda packet. This is something Willis gives us, and it'll outline just all kinds of options. So the lines correspond with each other. So the yellows match up with the yellow at the bottom. So what we were recommending here was number 4 and number 8 off of this chart. You can see what the potential annual savings is to the right. When you say annual savings, really it's cost shifting. We're shifting some of these costs to employees in the form of deductible and out-of-pocket maximum. So I do have, you see all those other colors on there. I do have all the other ones spelled out as well. I don't have to go through them, but they're here. If you want me to flip through them quickly, you can see what it does to the per paycheck increases for employees. Like I said, the yellows match up with the yellows on the chart to follow along. It spells out the additional funding that would be needed from the county. I'm pointing at my screen like you can see me pointing, but so again, there's 3 more of these. You want me to just quickly flip through those? See what they all look like. Sarah, I'll let you.
I think you could kind of just move through them quickly. The
Okay.
format's pretty similar.
Okay. Yeah. Yes. Very similar. So again, this is a $100 increase across the board. Additional funding about $108,000 from the county, and then an increase in paychecks. I don't have retiree rates on here. I didn't quite do that math. And then here's another option with a $300 increase across the board, increase in paycheck premiums, and additional $30,000 funding from the county. The other option, there's a couple of $100 increase to individual, and then a bigger increase to the out of pockets for family, which is where we want to get to. A paycheck increase for employees, and then an additional $98,000 in funding from the county. So in a nutshell, those are all of the options that were presented to us. So, you can mix and match any of these to see where you get. So just some stats on deductible and out-of-pocket maximum. We have about 1,600 lives on our plan. So those are belly buttons. So that includes all employees, their spouses, their kids. Last plan year, we had about 20% of plan members meet an individual deductible. About 8% of plan members met an individual out-of-pocket maximum. So the numbers are pretty low, and this is typical. You typically have about between 10 and 15% of your population, driving about 80 to 90% of your cost. And that it's that way with every plan. And then, I mean, you can see the stats from there. So far, year to date, we've had about 16% of people meet an individual deductible and about 6% meet an out-of-pocket maximum. And you can see where we're going with family. So other quick things, and all this is in the memo. Trustmark gave us a 1 and 3 year proposal. If we go ahead and take the 3 year, they gave us rates stay flat for next year, and then a 3% increase the other 2 years. Flexible spending, this might be a big one. The IRS temporarily has allowed an increase in maximum dependent care contributions. We all know how expensive daycare is. I assume daycares are starting to open back up, but they did double what a family can put into daycare. And then the medical contributions for medical flexible spending are staying the same. So this is voluntary if we want to adopt it. Again, it's really no skin off our back, because for dependent care, you can only get reimbursed for what you've put into the account. So there's no rollover features or anything. So really it's at the risk of the employee. So that's all I had. I will let Sarah, I don't know if Sarah, you have anything you want to add or questions?
Commissioners, I would just like to thank Michelle and her team and for all the hard work that's gone into preparing this healthcare renewal. It's actually really great that I think we're in a position where we can simply make plan design changes that will impact a much more limited group of our employee base and not impact every member of our plan's individual paychecks and what is taken out for their premium equivalents. So I think as we transition to some different plan design models, I think this is a really good year to be able to do those things, and just thank Michelle for her hard work on this.
This is Commissioner Portillo. Michelle, I want to echo what Sarah said. Thank you so much for the presentation. You make a very complicated policy. As much as I love getting into the nitty gritty of many policies, and we'll talk tax policy all day and all night, but healthcare is one that just is a difficult one. Thank you for making this really approachable for us. I do have one question, because when we had our work session, we were kind of talking about the potential of shifting to a consumer-based plan down the road. With this 3-year adoption, I do really like the idea of flat rates for this year, but it does seem like it's locking us into continuing. It is not locking us in. Sarah's immediately shaking her head no. Can you just help me understand that, kind of what the 3-year extension may look like?
Go ahead, Michelle.
Well, so, I mean, actually, now that, Sarah, you said we're not locked in. I mean, if we want to make.
So
go ahead.
I'm sorry. I think Trustmark is our TPA. So that is our third-party administrator. So the rate flat for them is what we pay them for their services to us as TPA. This is not rates flat to employees. So that was my head shaking no, is this would be a 3-year proposal for them as our service provider in that.
Right. I wasn't real sure where you were going with that question, but yeah, so it would, and then if we decide to implement a consumer-driven model like an HRA or an HSA, there will be different rates for that kind of administration. Because it may take some extra work to administer a plan like that. So that's something we would explore at 2022 renewal.
Thank you. That was my only question.
I don't have any questions, but thank you, Michelle.
I do have a few questions, and Michelle, thank you for talking to me earlier today. Okay. And maybe my questions come from the scars of a 10% increase 2 years ago. So my first question is, I'm interested in feedback from staff. And I know I received one email from an employee, and we may have some public comment this evening. And I remembered last year, we talked about having a benefits committee sort of formed across, to sort of look at these. Did you get I'm sure you met with staff, although during COVID, it's probably harder than when we all used to gather in the judge's chamber or in the courtroom over there. Did you get some feedback from staff on the proposal on these options?
We did not do the in-person meetings and do the healthcare committee like I want to do, that I'm hoping we're coming out of COVID and we can actually, have some in-person meetings, because I do want to form that healthcare committee and have representation from, a representative from every department, which we kind of talked about during our work session. We did do a Zoom overview with our staff, and I also did it with health department staff. We recorded it. I attended a staff meeting at the health department via Zoom, but we recorded it. We sent it out to everybody. There were a few minor questions during it. I haven't received any questions back since I sent out the link on Monday. So, it's been pretty quiet.
Thanks. And can you, so this holds the cost to our employees, this holds it flat over maybe it was in that table on page 5 and I missed it. I don't know that I saw it here, but can you tell us over past years how much we've increased the employee contribution over the past few years? Do you know that?
Well, Sarah would have, I'm still fairly new. She would have better memory of history of that.
Are your questions specifically about premium equivalents, Commissioner Kelly, or co-pays and deductibles?
Not co-pays and deductibles, but what the employee pays out. It's sort of unique to say you're not going to pay any more. It feels like in past years we had retirees pay more and we increased a little bit. This sort of seems like we're trading co-pays and deductibles for a flat employee contribution. Am I understanding that correctly?
You are. I would say that the difference between this plan renewal and previous plan renewals is we had to do both. We had to increase premium equivalents and co-pays and deductibles in order to meet the size of the increase we needed for the plan. When you're at a 1.7 or 1.8% increase without any sort of cost, I think there's less of a need to split it. And my concern is if we are moving towards a consumer-driven healthcare plan with a health reimbursement account, trying to baby step, which has been my thoughts with our plan all along, towards the deductible amounts that we're going to have to get used to in that plan. Let's use this opportunity to do that piece. And try to move toward, baby step towards deductibles that are more in line with that plan type. So, you're right. I don't have it all off the top of my head. We can certainly provide that history to commissioners. If you'd like to see what's happened to premiums over the last several years, that's certainly something Michelle and I could put together.
I know, I do. It's been an average of, it's been an average of about 6%. In talking to Willis, overall increases to premiums have been an average of about 6%. Something else I did was looked at some other government employers. I know there's some government employers that have higher wages than we do. And I understand that. I looked at where the city of Lawrence was at. I looked at city of Topeka, Shawnee County, Johnson County, state of Kansas, to kind of see what their individual and family deductibles were set up like. And they're all ×2. So, that's just, I think it's just industry standard to have your family deductible and out-of-pocket maximum 2 times what your individual is. Some of these out-of-pocket maximums, city of Topeka's got a $10,000 family out-of-pocket maximum. City of Lawrence has an $8,000. State of Kansas, their lowest is 11,000 for a family out of pocket maximum. So we're still rich in this benefit compared to our local. I mean, I'm thinking of people that we could lose employees to possibly, you know, I mean, so it's still a good benefit.
Yeah, thank you for that. I think, Sarah, what I was talking about is the fifth bullet on this slide, that there's no increase to contributions for employees and retirees. And just in the past, I know we have had increases in there in order to make it doable. So that's where I was getting sort of, it seemed like a trade-off to me.
And it kind of is. I mean, you could, that $25,000 that we're asking for from the county, I mean, we could put that in employee premiums if we wanted to, and have the county keep their funding flat. This felt like, I mean, because it was $25,000 was.
Yeah, I'm not wanting to put more hurt on our employees, especially this year. And this feels better about, I'm not advocating for that. I think I'm just more explaining a historical perspective on what we've had to do in the past. And I am a big, as Sarah and Michelle know, a big one to move to a consumer. And I think maybe at a later date, we'll hear some maybe baby steps we can take towards that. Because I guess Commissioner Portillo can probably talk about what KU's plan is. And this is a really great plan we have with the county. If you compare it to what our other major employers, the school district, the city, and KU provide, we seem to have the gold star plan in Douglas County. So just keeping that in mind. So
yeah, I mean, even so, as far as what comes out of their paychecks, they're not, you know, that's not increasing. Of course, your take home pay, you know, what you make in a year could decrease if you're one that constantly meets your deductible and your out-of-pocket maximum. Of course, it's going to be less. You know, I want to encourage flexible spending because that saves everybody money in the long run. So, you know, we'll try and ramp up that education on flexible spending. And, you know, if you're one that you have guaranteed out-of-pocket medical costs, do the flexible spending. I mean, it works so smoothly.
thank you. Sorry to get in the weeds there a little bit.
Sorry.
This is Commissioner Portillo. Are we ready to open this item up to public comment? Okay. Sarah, is there anyone at the courthouse for public comment?
No.
Jill, do we have anyone online for public comment?
I don't see any raised hands.
Okay, then we will bring it back to the commission for discussion. Any additional discussion by commissioners?
I don't have any more. I'm happy to make a motion if it's okay with commissioners. Yes, I'm seeing heads nod. So recommend approval of option 2 for the 2021-22 healthcare plan funding and plan design changes, as well as a 3-year renewal with Trustmark.
A second.
I'll bring that to a vote. All of those in favor, please say aye. Aye.
Aye.
Aye.
Thank you so much, Michelle. We really appreciate the presentation.
Thank you.
And we will move to appointments. Do we have any appointments to consider this week?
This is Commissioner Reed here. I just wanted to acknowledge right off the top of this section of our agenda that I unfortunately did not successfully connect with Food Policy Council folks, either Kim Kreiner-Ritchie or Tyler Lindquist. So I just didn't follow through soon enough and had a hard time making that connection for this week. But if other commissioners were able to have those conversations and want to discuss it here, I would enjoy that.
I had a quick conversation with Tyler and it was really wonderful, but I think that we can wait a bit more and give you time to have that conversation as well, Commissioner Reed. So if it's okay with Commissioner Kelly, I would suggest that we push this again.
That sounds good.
Okay, I appreciate that. Thanks. I will make it a priority this week.
All right, so no other discussion of appointments? we will move on to miscellaneous. Sarah, what do you have for us?
Commissioners, you have my updated memo in the packet. Just a few, there's some really great information on what we're hearing from the state of Kansas on beginning information related to ARPA funds. So our team is watching that all information closely. So you might want to take a look at that. And I'll just stand for any questions the commissioners might have.
No questions from me this week.
Also included, I'm sorry, because I also included as a follow-up piece of information related to the indigent public defense piece is and laying out that group's first meeting. And so I know there are some number of pieces of information in there that commissioners had asked for. We're still working on some pieces, but we're delivering quite a bit of that to you tonight as a part of that packet. Obviously, if you have questions on that, we're going to continue to work through this. You can certainly reach out to me or Mike Brower, and as we work through those questions. So those are the two big pieces in the packet. Thank you.
This is Commissioner Portillo. Thank you so much for including the Indigent Defense Work Group information. I'm excited for our first meeting, which will be Friday. So I'll be excited to report back to commissioners after we have that first get together.
And just to report to everyone, we have moved the sheriff's presentation on their data dashboard and our legislative update to next week's agenda. We're wrapping up that agenda now. So I think we'll have plenty of time to cover those items next week.
Do we have miscellaneous items from commissioners?
No.
I'll just share this, Commissioner Kelly. I'll just share with the commission. We had a meeting of the PERC on Monday, and we went through all of the requests to the city for economic development and approved. So that includes things that we are partners. So just keeping our discussion about partners. We are partners on Peaslee Tech, and there was some additional asks through Peaslee Tech. We also, from an economic development perspective, support the Chamber of Commerce here in Lawrence, and there was a significant increase to their request, and then and that included an early childhood request. So I think I just want us to be aware that as we partner on economic development issues, that some of those requests might be coming our way as well. And we need to keep our ears open for it. So yeah.
This is Commissioner Portillo. We do have a Peaslee Tech board meeting tomorrow, and I'm sure this would have been part of our legislative update, and it's in the memo that unfortunately the legislation for Peaslee Tech, for voters to vote on whether Peaslee Tech could become their own taxing district, did not make it through the State House this year. So they'll continue to be kind of supported by us in the city and our community, but won't be moving on to their own taxing district, which hopefully will be happening in the coming years. But I think it will be really interesting to see how Peaslee Tech positions itself both with the ARPA funds, but then also as we think about the infrastructure plans that are coming down, because the way that the infrastructure legislation is currently written, there's a pretty significant focus on workforce development for the first few years of funding. And I think Peaslee Tech really positions our community well to think about those workforce development pieces as we consider infrastructure throughout our community. So something for us to all just keep in mind as we read through those new pieces of legislation coming down the pipeline.
Great to hear you say that, Commissioner Portillo. I'm a big fan of workforce development and everything that happens at Peaslee Tech. That's really great. I would say, we've had some developments across our community in Kennedy Elementary on Monday night. I think that we as a county, and as we heard in our anti-poverty plan on that presentation, that early childhood is a big part of that anti-poverty plan. I know Jill Jolliker is attending a trip to Operation Breakthrough. I got to go on Friday. So if other commissioners have an opportunity just to hear what Kansas City, Missouri is doing around early childhood, I would encourage you to attend and have conversations with other community leaders about what's possible in that early childhood space. It is my belief that not many things could impact the health and vibrancy of our community more than deeper investment in early childhood. So I'm excited for us to have this conversation.
This is Commissioner Portillo. I believe I'm going to be going on Wednesday. This is also something that the Governor's Commission on Racial Equity and Justice has taken up, that all three of our subcommittees this year, economics, education, and healthcare, have decided independently to focus on early childhood. So we're coming back together as a full commission to consider early childhood, because we think that it does really span all of those sub areas and is something that as a state we really need to be working on. So I'm excited for Douglas County to be digging in on that. I know that we will see the formal presentation next week when we get to hear from the Sheriff's Office, but we had a CJCC meeting yesterday and we got to see the dashboards that are coming out of the Sheriff's Office. And I think it will be some really important information for us as a community and things that will be really helpful for the public conversation around criminal justice in our community. So I am excited for those conversations next week, and extra excited that our sheriff was amenable to shifting it to next week now that we are coming perilously close to my bedtime. Any additional updates? Okay.
For me, I was just going to say with that, Commissioner Portillo, I wonder if you'd appreciate an adjournment before that bedtime quite reaches us.
I would, thank you. So with that, we are adjourned.
Have a good night.